Good morning, everyone. Thank you so much for joining us for this World Food Safety virtual webinar. We want to thank you all for joining us. And this webinar is being organized by some ministries of government, the Ministry of Agriculture and Fisheries, the Ministry of Industry, Investment and Commerce, and the Ministry of Health and Wellness. My name is Stephen Davidson. I'm the Director of Public Relations and Communications at the Ministry of Health and Wellness, and I will be leading you through this webinar. And it is looking at our theme for this morning is Jamaica's food safety policies and regulations, ensuring safe food. And we have a panel of experts, which I will introduce as we go on throughout the webinar, who will be making their presentations. And we'll also have an opportunity to pose questions to the panelists and to have a discussion. And of course, food safety is everybody's business. And so we thank the organizing committee and everybody who is involved. And we also have giveaways as well. So I want us to pay attention to all the information that is being shared this morning during this virtual webinar for Food Safety Day. And World Food Safety Day will be celebrated on Monday. So it's Monday, June 7th, and we would have started a week-long celebration. And so today is a special day for our virtual webinar. It says the theme, Jamaica's food safety policies and regulations, ensuring safe food. And we are going to hear from the various government entities in terms of their roles and their functions in ensuring safe food. So at this time, I want to welcome our first presenter. She is from the Ministry of Agriculture and Fisheries and from the Rural Agriculture Development Authority. She's the Assistant Plant Health Food Safety Officer. So let us welcome at this time Mrs. Francine Webb Lawrence, who will begin to share her presentation with us this morning. Mrs. Lawrence.
Hi, good morning. Thank you so much. Right. Good morning, everyone. I would like to, on behalf of the Rural Agricultural Development Authority this morning, bring you greetings as we seek to share with you our offerings with respect to food safety as we celebrate World Food Safety Day. Now, the Rural Agricultural Development Authority is a statutory body under the Ministry of Agriculture and Fisheries, and we are the chief agricultural extension and rural development agency in Jamaica. And I also want to mention at this point in time that we are also celebrating 30 years of existence. It is our 30th anniversary, and our activities have continued from 2020 into 21. So we are also celebrating our 30th anniversary. You'll see and hear other things about that as time goes on as well. Now, with respect to food safety at the farm, there are three main contaminants that we look at. We look at biological contamination, such as from bacteria and other pathogens. We look at chemical contamination, and this is largely from our pesticides and including also some heavy metals. We also would attribute a lot of the foodborne illnesses that would occur due to biological contamination as well. So that is quite important. There's physical contamination as well, which is to a lesser extent, but not unimportant. And we also look at more increasingly now, where more and more of our population is becoming allergic to a number of different things, such as your milk, your nuts, your soy, your wheat, and also your shellfish. So our main vehicle for reducing these contaminants at the primary production stage is through the use of good agricultural practices. And these are largely guidelines which are there to reduce the risk of contamination to the produce. Now, in talking about good agricultural practices too, you also want to look at identifying the produce that you have with respect to its risk index. So is the produce eaten raw or is it cooked? Is it something that will come in contact with the soil? Or is it something that is going to present some kind of difficulty to be washed, such as like things like your cantaloupe and like your lettuce? And you can understand that these would have a greater need for ensuring and assuring that they are produced using good agricultural practices and that they have very little, if at all, any contaminants. Now, with respect to these good agricultural practices, there are some key areas that we focus on at RADA. We look at the land use, and at each stage that we look at, you look at how you can reduce the risk of contamination. And this reduction or this demonstration has to be verified. So you look at the documentation process so that you ensure and you are able to assure that all the necessary steps were taken in order to reduce the risk of contamination. So you look at areas such as your land use, you look at your agricultural water, you look at soil amendments, such as whether or not you're using manure, etc. You look at harvesting tools, you look at your transportation modes, you look at traceability. We talked about pesticides, and we also look at animal management. And key to all of this is worker health and hygiene. Now, for all of these areas under good agricultural practices, our work at RADA is largely collaborative. So we do a lot, we partner a lot with other agencies, with other stakeholders in delivering these good agricultural practices or ensuring good agricultural practices at the farm level. And I'll talk a little bit more about that level of collaboration as we go on. Now, whereas we are talking today about regulations and policies, the Rural Agricultural Development Authority is not a regulatory body. We are advisory, largely advisory. We provide technical advice to our farmers. However, because food safety begins on the farm, we see our role as being quite important in this food safety system or in this food safety relay, so that in moving on to the next stage, we have reduced as much as we possibly can our contaminant risk. So at the Rural Agricultural Development Authority, the Crop Care Unit was renamed the Plant Health and Food Safety Unit. It operates under the Technical Services Division, and it is housed within the Division of Technology Training and Technical Information. Now, recently, as far back within the last 10 years or so, a series of events occurred that thrust us into a major food safety focus. We had a number of rejections of fresh produce. We had the enactment of the Food Safety Modernization Act, and all of that gave us an opportunity to focus more or to target our focus on food safety and ensuring that at the farm level. Now, when I talk, I am from the crops side, but I also want to ensure that our livestock farmers do not feel left out, because the good agricultural practices are applicable to both crop production and also to animal rearing. And so when I speak, even though my focus will be on crops, I do not want to leave our animal farm or livestock farmers out of it, because equally important is good agricultural practices in animal husbandry as well. So under the food safety initiative I spoke about recently, we focused on a number of key areas. We looked at sensitization and capacity building of our staff, of farmers, and also of our exporters. That initiative that began some 10 years ago provided also infrastructural support to farms, looking at packing houses as well, and also to the agricultural marketing complex as well. We also provided support with respect to monitoring and evaluation. And because public awareness is also an important part, because food safety is everybody's business, and because the markets will dictate the standards that they require, you can understand that public awareness would play a very key part in this food safety thrust as well. And of course, the evidence of your efforts in terms of your documentary support was also a key part of this initiative. So there were a number of efforts that were made with respect to food safety records, with respect to gap manuals, and so forth. Now, under this initiative, we achieved quite a lot. When I talk about capacity building, we looked at some key areas for increasing capacity. We looked at the Food Safety Modernization Act, and we looked at other good agricultural practices as well. Now, when we talk about food safety, the tendency is there for people to think that we are focusing only on export. No, we want to ensure that we had a dual impact here. So our focus for this capacity building was not just farmers who were involved with export, but we also looked at increasing and reducing the gap between our farmers who produce for local market and also our farmers who are targeting the export market. Because if we raise the bar for our local produce, then of course the gap will be reduced as well. So that sensitization focused on both our export and our local farmers as well. We looked at safe and effective use of pesticides. That was a key area that we focused on. And we also partnered with the Ministry of Health and Wellness with respect to the hosting of food handlers clinics regarding personal hygiene and food safety, where a number of our farmers were engaged and received food handlers permits as well to build their documentary processes, to build that for themselves as well. Now, a number of these things with respect to implementing gaps at the farm level also required some amount of infrastructural support. So we looked at some key areas such as pesticide storage. We looked at packing shed facilities. We looked at sanitary facilities on our farms. And COVID-19 would have brought a number of these things into focus, such as your hand washing and that kind of hygiene. So while we would have started this before COVID, now we are seeing all over where hand washing is important and how hand washing can be brought into your operations with simple implements, such as just using the buckets. You'll see them even at the bars as you go around as well, to ensure that persons were washing their hands. So this is an important part and something that can easily be implemented at the farm level as well. We also looked at worker recreational areas and also building the documentation process within the farm. We looked at soil and water testing. So while we say that it is important for you to reduce the risk at each stage, you want to also be able to produce records that will verify and assure that you took the necessary steps at the necessary action at the different steps. So we looked at soil and water testing and getting those results from accredited labs as well. Now, monitoring was also a major part of this effort. We looked at checking of farm records. You know that farm records is also another key important part, and a part that we constantly have to be engaging our farmers with respect to keeping records. So that was also a key part, and we continue to make that effort. We looked at farm signage. Farm signage is something that I think COVID had also helped in bringing into focus, where everywhere you go now, there is some kind of information that is posted about safety and wearing your mask. So the same things can be transferred. I think it's far more relatable now, where we can talk about farm signage and the need for that at the farm level as well. We looked at mock inspections and auditing of records as well as the production of a number of GAP manuals, good agricultural practices manuals for different areas as well. Now, this is one such example I wanted to highlight that we retrofitted a container that was able to provide some assistance with respect to recreational areas for bathroom facilities as well at the farm level. So this was suitable for areas such as on our agro parks as well, where we have a number of farmers utilizing the same land space. Now, since then, within RADA, we have continued with this effort. We have institutionalized all this food safety and good agricultural practices training. We also provide assistance with the development of farm safety plans. We have continued our farmer registration efforts to assist primarily and targeted and specifically with respect to traceability. We have enhanced staff capacity. Our staff have been exposed to food safety preventative controls for human food, to Global Gap training, and also to Food Safety Modernization Act produced safety rules as training as well. So that capacity has been enhanced so that we are better able to serve our clients as well. We have increased our partnerships to provide greater support, such as with the Bureau of Standards of Jamaica. There is a local certification that can be had for farmers. So it's like I mentioned before, it's not just about export farmers. We are also looking at local certification, some assurance that you can give our local market with respect to assuring them that you utilize good agricultural practices in producing your commodities. And so the CAP, the Certification of Agricultural Produce, is one such program that we are working with the Bureau of Standards in sensitizing our farmers to this voluntary program as well. There is also the strengthening of our pesticide surveillance program, where we provide pesticide guides, and these guides have the pesticides that are permitted, legally permitted in Jamaica on a number of different crops. And also it includes the maximum residue limits for a number of our major markets as well. So farmers can be guided accordingly. And there's continued promotion of safe use of pesticides. And this again is in collaboration with the Pesticides Control Authority and our input suppliers. And of course, a major part of the food safety thrust is with our public awareness, with our consumers. And so we continue to engage our consumers, with our public, with numerous media interventions, with our shows, with social media, and so forth. So in summary, I want to join with Paul Mayers of the Canadian Food Inspection Agency in saying that we cannot provide zero risk, because that does not exist. What we want to do is to make sensible use of the resources we have available to minimize the risk to consumers to the extent that we can. And with that, I want to extend to all of you on behalf of the Rural Agricultural Development Authority a good World Food Safety Day on Monday, June the 7th. Thank you so much.
Thank you very much, Mrs. Lawrence, I should say, Mrs. Francine Webb Lawrence. She is the Assistant Plant Health Food Officer at the Rural Agricultural Development Authority. And of course, we say happy anniversary to you as well. We're going to continue with presentations from entities under the Ministry of Agriculture and Fisheries. And we're going to go to Dr. Susan McLennan Miguel. She's a senior veterinarian specialist, and she'll be making her presentation on the Veterinary Services Division of the ministry. So we'll have that presentation now. Welcome, Dr. Miguel.
Thank you. Welcome to all the invited guests, all our persons abroad. Thank you. And on behalf of the Veterinary Services Division, I am happy to bring greetings as well for World Food Safety Day, which will be celebrated on June 7th. Today, my presentation will be on the Veterinary Services Division, food safety policies and regulations. The Veterinary Services Division of the Ministry of Agriculture and Fisheries is a designated competent authority with responsibility for the administration of the National Animal Health Certification, disease surveillance, prevention, eradication, and control programs. We have this motto that we have. We are ensuring healthy animals for a healthy you. But even though I'm speaking on behalf of Veterinary Services Division, food safety is a shared responsibility. And so we and the veterinary team that is in Jamaica, our stakeholders, our farmers, our processors, our traders, if we work together, that's the only way we can make food safety a reality here in Jamaica. What is our mandate at the Veterinary Services Division? We are safeguarding the livestock industry. That's true. We do so through monitoring and surveillance programs. We also are promoting animal health and welfare, and we do that through policy and protocols. We continue to facilitate trade through making sure that all our processes are transparent, we have standards, and we have to continue communicating with our stakeholders. We also endeavor to keep exotic and zoonotic diseases out of Jamaica. This we do with doing risk assessments, and we have quarantine protocols that we follow very strictly. We are also enhancing food safety, and we take it very seriously because we are doing risk-based inspections and we're doing risk-based testing as well. And of course, all of this is to improve public health. We do that by conducting registration of all the facilities that have animals or animal products. And of course, through even this forum this morning, we are doing public education. How are we set up? Well, we have a director, our chief veterinary officer. And of course, we have the supportive administrative staff and secretarial staff and finances. But the real technical support is through 4 units that we have. We have a laboratory services unit. We have a permit and quarantine services unit. We have field service, also with artificial insemination animal fertility unit. And we also have a veterinary epidemiology, public health, and food safety unit. Unique thing about it, the laboratory service has 3 lab sections: the diagnostic lab, the residue and biochemical lab, and the PCR lab. For the permit and quarantine unit, even though the central office is in Kingston, the oversight is the entire island. So we look at the airports and the seaports. In the field, we covered 14 parishes, and with the veterinary epidemiology and public health and food safety unit, we are covering terrestrial and aquatic animals, along with epidemiology assessments. So here we are, a nice map of Jamaica. And here you see our parish offices are in every single parish of Jamaica. Right in the center in Kingston St. Andrew is where our central office is. Of course, just for visual aid, these are our units. At the central office, We have the permit and quarantine unit. We also have the veterinary epidemiology, public health and food safety unit. We have the field service unit, and we have the veterinary diagnostic lab, the PCR lab, and the residue and biochemical lab, right here at Hope Gardens. Isn't it a beautiful view? What is our scope? We cover all areas concerning animal health and zoonosis, both local and international representation at meetings, conferences, and committees. We are overseeing terrestrial and aquatic animals. Animal production food safety is also a priority for us. Animal health and welfare. We're making sure that we are covering all aspects of animals, both domestic, wild, and for food. We also look at disasters, animal diseases, man-made or natural that may affect our animal population. We have a keen interest in diagnosis and control of diseases and assessment of animal health status. Public education is a key. And of course, we go out of our boundaries of Jamaica and look at other countries where we are getting import or products from. We do country inspections to know what is their animal health status and their control measures. Today, we're talking about the policies that governs the Veterinary Services Division. The National Food Safety Policy is one that oversees what we're doing, and that was approved in 2013. We also have the National Food and Nutrition Security Policy. That was approved in 2013 as well. We have a National Food Recall Policy, and ones that we're still working on is Animal Health and Welfare Policy, the Fishery Policy, the Livestock Policy to be developed, and all of these policies, they can be found at our Cabinet Office. What about our acts and regulations? For us to do our work, we have to be licensed and registered and licensed under the Veterinary Act of 1975. Every veterinary surgeon that is practicing in Jamaica needs to be registered and is gazetted and published in the Gleaner by May 1st of the coming year. So already the list of veterinarians have been published in the Gleaner in May 1st that has gone. The animal health technicians or the technicians that work with the veterinarians out there, they are also enrolled under this act. Where do we find these acts and regulations I'm going to be talking about? At the Ministry of Justice website. We also have the Animal Disease and Importation Act from 1948 and its regulations 1983. We have the Meat Products and Meat Byproduct Act of 1999. We have the Aquaculture, Inland Marine Products and Byproducts Act of 1999, but now it has been amended to add local trade in 2013. What about the regulations? The Aquaculture, Inland and Marine Products and Byproducts Inspection License and Export Regulation of 2000 changed its name and now is known as Aquaculture, Inland and Marine Products and Byproducts Inspection and Certification of Fishery Facilities with prescribed forms. This was done in 2002. Other legislations also support what we do. We have the Food and Drug Act, which you may hear of later. The Public Health Act, we're going to hear about that later as well. Processed Food Act, the Beast Control Act, the Fishing Industry Act, the Agriculture Producers Act, Prevention of Cruelty to Animals Act, the Pound Act, the Keeping of Animals Act, the Fertilizer and Feeding Stuff Act, the Penal Larceny Act are just a few of the supporting legislation that support our work. So let's look at some of the units. The Veterinary Epidemiology, under the Act, the Animal Disease and Importation Act and other legislation, conducts these activities. Animal health surveillance plans and strategies. They also look at animal import risks, assessments and analysis for any products or any animals that are coming into this country. We also look at the risks at the farm level. We do disease investigation and reporting. And of course, veterinary data gathering and management is a key key for the epidemiology work. All of this can only be supported if we continue to do our training and public education to our stakeholders that all the data that you produce, we need to get so that we can make decisions for our animal health status here. The Veterinary Public Health Unit, which we do have, also guided by the Animal Disease Importation Act and the Meat and Meat Products and Byproducts Act. Also the Aquaculture Act, which is not here. But for this, what are we doing in this unit? Well, all the veterinary medicinal products that are coming into this country, they are licensed under the Ministry of Health. However, we need to have a registry here at the Veterinary Services Division. And as such, we grant permits for persons to bring in these drugs when they apply to us. Farm and pet stores registry and being inspected, this is what we're doing now to put you on a registered list and so that we can help you how you display your products for the animal population. Zoos and animal attractions, we are registering them and inspecting them. The veterinary products request evaluations we get every day, both from overseas and local. We conduct evaluations on them. And if they're okay and approved, we approve them. The zoonotic disease surveillance is an ongoing effort that we do. We are looking for tuberculosis and brucellosis, leptospirosis. These are ongoing disease surveillance that we're doing. Waste disposal plants, we have to key on them because, you know, we have to make sure that our animal population or our animals that have died must be disposed of, or the animal products must be disposed of properly so that it will not cause a problem to the environment and to humans. Of course, all of this has to be done through training and public education. The Aquaculture Food Safety section also is governed under this act, the Aquaculture Act and the Animal Disease Importation Regulation Act. What do? They do inspection and certification oversight for fishing vessels and transport vehicles. They also do inspection and certification for processing plants and seafood harvesting. They're out there in the sea collecting samples as well. Approve and license of these processing facilities is also under their oversight. Farm registration of your tilapia farms or any farms that you're doing fish products is a must. We also do country inspections abroad so that we know that the product that you're planning to import into Jamaica has met our standards. Training and public education is an ongoing effort. The Terrestrial Food Safety Part of Food Safety is under this legislation. We're also doing import risk evaluation because most of the products, feed products, veterinary products, animal, the eggs, the hatching eggs, all of these are inputs into our farm production. And so they have to undergo risk evaluation. Surveillance of all stages of the animal production is key. And so we're registering cold storage, hatcheries, feed mills, farms, transportation, slaughtering facilities, and the processing plants for export. Once these have been registered and we conduct inspection audits on them, they are approved and given a temporary registration number. We can't do this unless we take GPS coordinates of where these are located. That's key for traceability. And so even the animal markets that are where animals are sold informally, they too have to come under our radar. We can't do this without the farmers' work. And so good agricultural practices manuals are being produced and training is being conducted to our farmers. Surveillance programs for antimicrobial resistance, which is an increasing concern for the safety of our food and having antibiotic residues in our food, is one of the key programs that the Veterinary Services Division is going to embarking on. And we are starting that in the livestock sector. Of course, we do country inspection visits as well to other countries who might want to import products to us. Training and public education is a must for everybody to understand the work that we do here. Permits and quarantine, they do a lot as well. When you want to import anything into this country, you need to register with them. Once you do that on the MOA trade system and your application is approved, then your permit is granted. Once the product is coming here, you alert the Veterinary Services Division again, and port inspection is done, both at air and sea. Whichever ports they are, we are there. Cargo, passengers, crews, we do the inspections there and the products. Documents are reviewed, issues of health certifications are produced for export. Site inspections are done. Live animals and animal products are inspected for exports. And of course, training and public education as well. The field is not left out because we need to make sure that our local population is healthy. So disease surveillance and investigation is continuing to be done. Processing facilities are inspected. Farm and farmer registration is being done. Start up with the cattle population. This is what NACE is, the National Animal Identification and Traceability System. And of course, this has to be done continuously with training and public education. Veterinary labs, our last unit. They are doing animal disease surveillance and support it. They support the food health disease surveillance, zoonotic disease surveillance, the veterinary drug residue surveillance, the marine biotoxin and toxic phytoplankton surveillance. They even look at parasites. And of course, they are accredited now, which is yay for us, we're on our way. What are some of these things they're looking at? They're looking at microbials, which is at the left. And of course, they're also looking at residue and biochemicals, which is on the right. How are we guided? OIE, World Organization for Animal Health, which originated in 1924, have provided with the government of Jamaica and vet services all the technical health, animal health code, aquatic animal health code, and diagnostic manuals to help us to strengthen our veterinary services support. We have focal points for animal production and food safety, which I am one. And foods, we also have a focal point for veterinary medicinal products. And we have a focal point for fishery products. What about FAO, Food and Agriculture Organization? We also rely on their resources, good practices for feed, for dairy farming, for the meat industry and farming practices. And of course, we cannot leave out Codex Alimentarius. We are guided by their code of practice, guidelines and standards for the practice of meat, food hygiene, use of veterinary drugs, fish and fishery products, and of course, the code of practice to minimize and contain foodborne antimicrobial resistance, which is under review at this very moment. Remember, when you eat your oxtail and rice and peas, or you buy your jerk pork, always remember that we are tracing the food from the farm to the plate. To wrap up, all right, sorry about that. I have to go to the last slide. Wasn't working. So to wrap up, Veterinary Services Division Food Safety Legal Framework, we are collecting, analyzing, and disseminating information. We're a science-based approach. We're publicizing health standards and animal products. We are conducting controlled products because we want to provide guarantee to our stakeholders. And of course, we are implementing zoonotic disease programs so that we can improve public health. On behalf of the Veterinary Services Division, we endorse World Food Safety Day. Remember, food safety is a shared responsibility. We cannot do this without you. Thank you.
We got to be careful when using pesticides.
All right, Richie.
Oh, go on.
Can I come out to mash up some spraying idea?
Yeah, I go spray them corn there.
So, are the three wearing the protective gear?
Boy, the sun too hot for suit up here, man.
So you read the label before you start? Wear protective gears. Your goggles, your respirator, your gloves, and a coverall. At least you did have on a cap. Mix only what you need for the day. Use only on the crops listed, and if some chemical left over, make sure you store it in the original container.
For more information, call the Pesticides Control Authority at 754-9306.
All right, thank you very much, Dr. Miguel, for that presentation. And I think that concludes the presentations from the Ministry of Agriculture and Fisheries, the food safety regulations. And there, of course, we would have had Mrs. Frances Webb Lawrence before speaking about plant safety. And of course, at this time, I would invite those who are in attendance, if they have questions, they can pose them in the chat, or they can use the raise hand feature to ask their questions in this segment. I see here from Paul Brown, he's asking, it said it would be good to get a sense of the level of coordination of the activities between the Ministry of Health and Wellness and the Ministry of Agriculture and Fisheries. For example, how do the ministries work together in the case of investigations and recalls of suspected contaminated meat products? Does it make a difference whether the meat is cooked or raw in terms of which ministry would be activated? And if Dr. Miguel, can you respond to that? Or if we have a rep from the...
Sure, I can do so. Yes, so once your product, whether raw or cooked, the Ministry of Health and Wellness takes the lead in that. Once they do their investigation and they trace it back to the farm, if the problem is from the farm location, then they work with us by alerting us, and then we follow through with the animal health requirements. I hope I've answered your question, Mr. Brown.
All right, thank you very much. And if any of our other attendees have questions regarding the presentations, you can use the raised hand feature on Zoom to ask. And I actually have a prize question to give away. So Dr. Miguel would have mentioned the international body that we get guidance from. So anybody can tell me the name of the international organization as it relates to animal health that we are guided by and we work with, then I have a prize for you. All right, and you're raising your hand. All right, so the first hand I see raised is Alvarez Harris. I'm gonna allow you to speak, to open your mic and give us the response.
Hi, good morning.
Good morning.
The answer to the question is OIE.
And what OIE mean?
World Organization for Animal Health.
All right, thank you so much. All right,
Yes.
that is correct. Congratulations.
Thank you so much.
All right, thank you. So listen now, you have to be paying attention to all the presentations because we have prizes to give away. So we're gonna move now to the Ministry of Industry, Investment and Commerce, and we have 3 presentations from there. And I want to welcome at this time the Chief Food Safety Inspector, who is Miss Maxine Hoffman. She'll be making her presentation at this time. She is the Chief Food Storage Inspector for the Food Storage and Prevention of Infestation Division at the Ministry of Industry, Investment and Commerce. So please welcome Ms. Hoffman to make her presentation at this time.
Hello, morning.
Good morning.
Are you hearing me?
Yes, we're hearing you.
Okay, I'm Maxine Hoffman, Chief Food Storage Inspector of FSPID. FSPID, Food Storage and Prevention of Infestation Division, which was founded in 1958. It's a division under MIIC. Our Act and Regulations was amended in 2019. And we operate under the FSPI Act and regulations. Our function is to ensure food safety and wholesomeness and assist in mitigating loss of merchandise. We provide technical and regulatory services to ensure the safety and wholesomeness of food and feed entering commerce through sound scientific principles in a timely and professional manner. It is a division that is equipped, structured, and staffed with qualified and competent persons to properly implement government policies. The division is comprised of more than one unit. One unit is the Inspectorate and Disinfestation Unit, the IDU, and there are also 4 testing labs. These are the Microbiology Lab, Entomology Lab, the Pesticide Residue Lab, and Rodent Biology Lab. There's also a Research Lab, which is the Post-Harvest Lab. The Inspectorate Unit, or the IDU, has responsibility for reducing food and feed loss due to infestation and contamination. The unit routinely inspects food and feed, any place, premises, or vehicle, which vehicle includes cargo ships and aircrafts, where food is kept for sale, is stored, manufactured, processed, or is being transported. The inspections are done, we do inspections at the ports of entry in Jamaica and also all food and feed premises in the island. The IDU has been accredited for ISO IEC 17020 since April 2019, it being the first and only accredited body for inspection in Jamaica and the second in the English-speaking Caribbean. As an accredited body, our inspection activities are being done at an international standard. Our inspection is governed by the Act and Regulations and the ISO IC 17020 standard. We have well-trained and qualified inspectors to conduct our inspection activities. Samples are taken when necessary, and these samples are analyzed by our 4 testing labs. Results from these samples allow the inspectors to make informed decisions about food safety, decisions such as disposal of infested food or feed. Inspections are done on imported food items and on animal feed, and raw materials for animal feed. There's also the export food and feed are also inspected by us, and these include our traditional crops that are exported, like our cola nuts, coffee beans, and others, and also animal feed that are exported. Surveillance inspections are done throughout the island at food premises, such as our supermarkets, wholesales, distributors, or bakeries, hotels, hospitals, schools, farm stores, produce dealers, feed mills, factories, spice dealers, restaurants, grocery shops, among others. IDU under FSPID also has responsibility for disinfestation activities such as fumigation of export goods and also disinfestation activities of local goods and on food premises. There is a training unit also at FSPID that has responsibility for continuous training of our inspectors to ensure that they are abreast of food safety practices and new technologies. For our island inspection or inland inspection, we look at storage areas and in food premises, and storage areas, we look at things such as stocking of goods, cold storage areas, the product condition. We look at pests
interior, exterior of the premises, testing the commodity as well. We also look at threats of infestation on the premises or in the commodity. We also look at rodent proofing. We look at pest management measures. We look at sanitation. We try to ensure that they prevent, detect, or manage foodborne risk. And we look at the environment itself, which is the building interior, the walls, the ceilings, the floors. Ensure that no pets are in the building, pets in the building. We look at the building exterior, like for example the drains, and any sign of infestation as well as the sanitation. In terms of preventing foodborne risk, our main thing is inspection. In terms of detecting, our main purpose is through inspection, and in terms of managing, our main thing is disinfestation activities. Sorry. We have two offices. Our main office is at 15 to 17 Guntown Road in Papine, and our regional office is in Montego Bay in UGI building at 30 to 34 Market Street. We have a complement of over 20 inspectors that service the island, and we can be contacted at 977-6816-20 or 927-1929-30. Also, you can visit our website. Our Act and Regulations is on the website. You can download and get abreast with what you need to understand about food storage, and our contact information is there as well. That's it. Thank you.
Thank you so much, Ms. Hoffman, and good to learn more about your division. We're going to move to the next presenter from the Ministry of Industry, Investment and Commerce. And under that ministry, we have the Bureau of Standards Jamaica, and Mrs. Sharika Satchel Knight is our presenter from the Standards Division. So we welcome Mrs. Satchel Knight at this time to make her presentation.
A very pleasant morning to all the persons that are here on this webinar this morning as we commemorate and celebrate World Food Safety Day. Please confirm if you are seeing the projection of the presentation that I'm about to go through.
Yes, we are.
Fantastic, thank you so much. As was mentioned before, my name is Sharika Satchel Knight. I'm the coordinator of the Food Safety Modernization branch at the Bureau of Standards Jamaica, and it is my pleasure to present information regarding BSJ's role related to food regulations, and that is for the local and for the international market. So I will take us through a bit of information as a preamble first by looking at food safety and just why is food safety important. And then I will segue into the purpose of BSJ, who we are. And then I'll look at the legislative framework which governs the work of the Bureau of Standards and the role that we play as it relates to regulations related to foods on the local and the international market. Now, I think persons will agree with me that oftentimes a question of whether your food is safe may not necessarily be the very first question on your mind if you have had a long day and you're hungry and you just want to have some food. Or if you go out with your friends and you're enjoying food at a restaurant, perhaps one of the last things on your mind is whether or not the food that you are eating will cause you to be ill, or peradventure, it may cause you to die. But I hasten at this point to say that these are very, very serious questions that, I mean, we have to ensure that we have answers. Is your food safe? And that is particularly important, as I will demonstrate through some information about statistics that show just how important food safety is. Now, access to sufficient amounts of safe food and nutritious food is key to sustaining life and promoting good health. And unsafe food causes more than 200 diseases that can range from diarrhea to cancers. And unfortunately, as we mentioned before, it can cause death. The World Health Organization estimates that every year, 600 million persons, that is almost 1 in 10 persons, fall ill after eating contaminated food. A little under 500,000 die every year as a result of food contaminated, eating food that is contaminated. An unfortunate fact also is that children under 5 years old carry 40% of the food disease burden. So every year we have over 125,000 children dying. And we have about 110 billion US dollars that is lost each year in productivity and medical expenses. Based on information gathered from the US Food and Drug Administration, it is estimated that some 1 in 6 Americans suffer from foodborne illnesses, with 100,000 hospitalizations, 3,000 deaths, and more than $15.6 billion as a cost. For Canada, some 1 in 8 Canadians are affected by foodborne illnesses, with 11,600 hospitalizations and 238 deaths, and a costed economy of $1.1 billion. An unfortunate truth is some of this information for the local scene is not necessarily easily and readily found. But what we can recall is there are many instances that we have seen reports of foodborne illnesses locally with devastating impacts, perhaps not at the level as we're seeing in these other countries, but certainly with as much of an impact. But once it is you have persons being ill or being sick or dying, then we know it is a serious case for concern. What does this mean? It means that local brand owners, product manufacturers, and importers, you're all 100% responsible for the safety of food. So if you supply food locally, it is your responsibility to know and comply with the applicable local requirements and processes. And if you export food, it is your responsibility to know and comply with requirements for the country to which you're going to be sending your food. If you're subject to certain regulations, the food must be safe. It must meet the regulatory requirements. It must be of a nature, substance, and quality that complies with the composition and grade requirements. And whatever labels or advertisement that is going to be used for this food must not be false or misleading. And again, they must meet regulatory requirements. So what is the role in Bureau of Standards in all of this? Let me start by saying the Bureau of Standards Jamaica is the statutory body under the Ministry of Industry, Investment and Commerce. It is led by a 14-member Standards Council, and we're headquartered in Kingston. And there are 4 regional offices in Mandeville, Montego Bay, Savannah, Lamar, and Ocho-Rios. The vision of the Bureau of Standards, we are the premier customer-focused, technology-driven organization that leads the development of national and regional quality of culture. We are customer-focused, accountable, responsive, excellent, and supportive. The Bureau of Standards is here to promote competitiveness of our Jamaican producers and give us a competitive edge and advantage when we're competing on the global market. So not just locally, but our products must be needed and wanted and demanded from any corner of the world. We are here to facilitate business development and trade, and we support customer protection by providing a number of valuable services, which I will elaborate on a little bit from now. The activities of the Bureau of Standards are governed by a number of acts and attendance regulations. The activities of BSJ are governed by the Standards Act, and we are established as a statutory body by the Standards Act of 1969. And when we were established, we assumed administrative provisions for the Processed Foods Act. When the Weights and Measures Act was promulgated in 1976, we also had the responsibility for legal metrology. But major changes have happened since then. In response to changes locally and to evolving needs of our stakeholders, there have been many changes, chief among which I want to mention is that the regulatory functions that are attendant under these regulations and a part of the acts have now been delegated to the National Compliance and Regulatory Authority. And the NCRA was established in 2016, and my colleague a little bit later from now will provide more information as he will be able to speak more fluently about the NCRA and its functions. But just to say, based on changes, we had to pivot, as the term is being used now, so that we are able to meet the changing needs of our stakeholders. So Bureau of Standards now has a posture of what I call facilitators and not regulators. And we are strategically now placed to offer the kind of support that the food industry requires to enable them to meet the requirements of regulations for food, whether it is for the local market or for the international markets. For instance, there are mandatory food product standards that exist that many of us may or may not know about. For instance, did you know that there was a standard for Akis and that there was a standard for coffee? Did you also know that there were standards for other food products that are mandatory? And so if you are a producer of those foods, you are required to follow the requirements in meeting those standards. Additionally, there are other standards like the JSCRS 5, which deals with prepackaged food label. Therefore, if you are packaging food locally, you have to meet the labeling requirements that are set out in these standards. Additionally, JS 36 is a standard that speaks to requirements that establishments need to follow in order to meet sanitary and food safety requirements to ensure that the foods they're producing are safe and will not cause harm or ill health to persons or death if persons consume them. And of course, there are many other standards. For instance, I want to mention JS 317, which is a standard which speaks the requirements when putting HACCP systems in place. So these are standards that food industry persons are able to access and to meet those requirements when putting their food safety systems in place. Additionally, there are international regulations and acts that are required if persons are going to be sending their food to these markets. For instance, I mentioned earlier that it is important to know the regulations that are required for the markets for which you intend to send your food. For instance, if persons are interested in sending their food to the United States of America, you must know meet requirements that fall under the Food Safety Modernization Act, which I will call FSMA. And under FSMA, there are certain regulations that have been promulgated that span the entire food supply chain. So if you're interested in sending your food to that market, you will have to meet requirements that are applicable to the food that you are sending. And I also wanted to mention that there's a Safe Food for Canadians Act. So persons who are interested in sending their food to Canada, you have to meet those requirements. And so it is many other countries will have their acts and attendance regulations, and therefore persons must meet those requirements. I just wanted to quickly bring up the different regulations that were promulgated under FSMA. Produce safety rules for persons who have activities that fall under the category of farms and the farm definition and farm activities. Additionally, for persons who produce food that is consumed for human, consumption, you have to follow the regulation that covers preventive controls for human food. There are rules for animal foods, there are rules for supplier verification, and there are rules that cover intentional adulteration. So persons now, facilities now have to put in place mechanisms that, one, help to mitigate any incidences where deliberate acts of adulteration can take place. So they now have to do assessments of vulnerability to see what processes may have certain vulnerabilities, and they now have to put measures in place to counter those vulnerabilities and then have corrective actions if they are breached and have certain records. I just wanted to pull out some of the regulations that fall under FSMA. Let's go back to some of the functions of Bureau. Now, as I mentioned before, the Bureau of Standards, we are not a regulatory authority. We're not regulators, we are facilitators. And we provide support to the local food industry by, one, providing access to the regulations. So through the Food Safety Modernization branch and through the Regional and International Trade branch, persons are able to access standards, regulations, requirements that are needed for the different markets for which they are interested in sending their food products. And what is also important is the Regional International Trade branch is the national inquiry point for the World Trade Organization Technical Barriers for Trade. What does that mean? If countries across the world are updating their regulations pertaining to food and other products and services, that information will be notified, and the notification comes through that branch. So persons are able to know, request information regarding the market requirements for that country. The role of the Food Safety Modernization branch is specific to the US market and the Canadian market. And based on information we collated last year, there are other markets that are now being requested from the branch. And so we will seek to expand as best as possible to provide that information about other areas. But certainly some of that information can be gleaned from the Regional and International Trade branch. In terms of access also, we have the Artnell S. Henry Technical Information Center, and that is a resource center that has the mandatory and the other standards that are available for viewing or for purchase. So persons, if you want to know what is contained in the standards, you are able to go to or contact the library, and you are able to access and purchase the standards. So Bureau supports the industry, by providing access to the regulations. One of the other unique offerings of the Bureau of Standards is we allow for participation, or facilitate rather participation in the development and adoptions, modified adoptions, etc. of standards. What does that mean? It means that the local food industry is able to participate in the development of these same standards for which you need to be compliant with. So for instance, through the work of the Standards Development Branch, which is headed by Mrs. Karen Watson-Brown, persons are able to be a part of technical committees and are able to gain access to the standards through these committees and participate in their revision, their development, and can safely say that they were a part of the process. And if they had any challenges, they would have been able to articulate these challenges at the place where they're being created. What is also important is through the Food Safety Modernization branch, we are also able to participate on the international scene, because once it is that the US has any updates or modifications to their regulations, they also notify and invite persons to do comments, and persons are able to send their comments through to the branch, and we are able to relay that to FDA. What is always good is they are able to process and take into consideration the concerns or the issues that are raised, and put them into the process when they are making their final decisions about their regulations. So you absolutely have a seat at the table when it comes to participating. What is also true is at the level of the standards development process, you are able to participate locally, internationally, and at the level of the region. So you can always contact Mrs. Karen Watson Brown, or for the Regional International Trade Branch, Mr. Farah Smith. BSJ also supports by providing verification through testing. There are several labs that are at the Bureau of Standards. We have labs from the microbe department, so microbiology lab, chemistry lab, and a packaging and non-metallic and furniture lab. So therefore, if you have food products that you want to ensure that they meet the requirements of the regulations for which you have to be in compliant with, then we are able to provide the testing that is necessary. For instance, also there are labeling requirements that are necessary, and persons have to put nutritional information on your packages. And so certain tests are done through the chemistry branch, which allows for nutrition labeling to be done. And additionally, the packaging lab offers local labeling assessments and approvals. And some measures are being placed to provide some tools that can help persons to comply with the foreign markets, the US and the UK markets, with regards to labeling. Also, if persons want to do commercial sterility, for example, they are able to send their products to the microbiology lab. And if they want to do extraneous matter, whatever other verification activities, what if you need to do environmental studies or environmental assessments of your facilities, you can get that done through the labs. Additionally, there are CAN-SEAM analysis, as I mentioned before, is done through the packaging lab and labeling assessments. Calibration activities are also done through the Bureau of Standards, and these services and testing services also are provided by the Metrology and Mechanical Lab, the Electrical and Electronics Lab, and the Testing and Industrial Services Lab. So persons who use their temperature indicating or temperature recording devices or thermometers, etc., you are able to submit these to the Bureau of Standards, or we're able to send our representatives to do calibration activities, because certainly you want to ensure that the machines, the scales that you are using are providing the correct measurements and are helping to give you the right characteristics that you are testing for your products. BSJ also provides training services through the Quality Institutes. Many of the food regulations have specific requirements for training that must be fulfilled. And the training is provided through the Quality Institute that helps to fulfill some of these requirements. For instance, there is a need for food safety training and GMP, good manufacturing practices training for persons who work in the food industry. And these are some of the trainings that are offered through the Quality Institute. Training also includes ISO 22000 food management system training for root cause analysis, for report writing, for food fraud, food defense. So all of these, and food defense is particularly important because for persons who manufacture food to the US, there's a requirement to have in place requirements that meet the intentional adulteration rule, and persons must be aware of defense strategies and what food defense is, and help to mitigate the incidences of intentional adulterations by persons that intend to cause wide-scale harm. And if all of those other services were not enough, the BSJ has embarked on what we call the client servicing program, whereby it is literally, we call it a hand-holding program. So persons are able to get information about the different requirements. We're able to hear what needs they may have based on the requirements, and we're able to offer assistance, whether it is technical assistance or advice, in terms of the interpretation of the requirements, and help them to think of what it is that they need to put in place to meet the requirements that need to be fulfilled. Certification activities are also done through our sister agency, the National Certification Body of Jamaica. And basically there are several products that fall under the mandate of the NCBJ. already was mentioned of the certification of agricultural produce program, and there are other programs such as the Jamaica Made Mark. There are certifications ISO 9001, and then there's a national certification mark program which covers product and plant certification. The NCBJ is also responsible for organic certification, so you can contact them for more information where that is concerned. So in a nutshell, I just want to mention again that while we are not regulators, we have a pivotal role in ensuring that our food stakeholders in the industry are able to access the information that is required, understand it, and are able to put measures in place to meet the requirements. We also want to share information, so if persons have questions, they're able to contact the Bureau of Standards Jamaica for this information. If there's testing that you need to be done, whether on food products or the equipment that you need, you want it to be calibrated, you can send those on as well. I think I want to think of the Bureau of Standards as almost like a treasure trove. There is a myriad of resources that can be accessed. And so we invite our food safety, our food industry persons to make contact with the Bureau of Standards so that we can help you in your bid. This concludes my presentation. More information can be found on the various websites for the international markets, and especially also the local markets information can be found at bsj.org.jm. I have put there the information for the branch, the telephone number, and my email address. So if persons are desirous of making contact, you may do so. Thank you so much for listening. And I am thrilled to be a part of this year's staging of the World Food Safety Day. Thank you for the invitation, and I hope the information was meaningful. Thank you.
Thank you very much, Mrs. Knight. And of course, the information is useful and timely. I hope persons are paying attention to the information that is being shared from the Bureau of Standards. If you're joining us, this is the virtual webinar for the World Food Safety Day. On Monday, June 7th is the actual day for World Food Safety Day, but we are hosting this webinar today. This is brought to you by the Ministries of Agriculture and Fisheries, the Ministry of Industry, Investment and Commerce, and the Ministry of Health and Wellness. We should have a third presentation from the Ministry of Agriculture and Fisheries. And I'm going to invite Mr. Damian Rowe, who is online. He's a senior plant quarantine SPS inquiry point officer in the plant quarantine produce inspection branch, to make his presentation.
All right, thank you. Good morning, everyone. I would like to begin this presentation by saying that the plant quarantine branch of the Ministry of Agriculture and Fisheries, we're happy to be here, happy to join with our colleagues from the different agencies to provide plant quarantine input in the whole World Food Safety Day and share with you what we actually do on a daily basis regarding food safety. So we are to appreciate plants because plants provide over 80% of the food that we consume, and of course, the things that we use plant for, to make furniture, to make pallets. Even in your home, you can find so many things that are made from plant materials, and we have to give thanks for that, right? And that's why we are here at Plant Quarantine, so appreciative of plants, and we try to respect the movement to protect plant life as much as possible. In the year 2020, we celebrated International Year in Plant Health, and we constantly try to remind all of our colleagues that the International Year in Plant Health continue even in 2020. and 2021. And we just, while we are celebrating World Food Safety Day, we give thanks for and support to internationally and plant health as well. Just to say that plant, you know, in the essence, there are so many diseases that impact plant. And you know, it causes so much economic loss that can come from the loss of plant. You know, we have agriculture, we can lose our markets, our natural environment. We are losing valuable plant species. With the impact of pests, it impacts our food security. Our production, when it comes down to food security, is at risk when we have certain disease that enter the country. And we talk about frosty pod rot of cocoa and citrus greening. You can look at the pictures and you see the greening of the citrus plant there. And you wonder why citrus or lime is so expensive in the market. It's because of citrus greening. We are spending over 300 million on a yearly basis. Well, sorry, it's 100 million on a yearly basis. So far, we have spent over 300 millions to control frosty pot rot of cocoa. Just because of the importance of the industry to the country, to the export market. On the screen, you are seeing so many pests that have entered the country over the year. Lime swallowtail, red palm mite, pink hibiscus, mealybug. Remember when that pest came here the first time, we were so scared. We were like, you know, going crazy. What should we do? It's gonna deplete our fruit industry, it's gonna wipe out our fauna or flora. And we eventually find a way to control that. At this stage, we're looking out for tropical racework banana and hope that this disease doesn't come to Jamaica any at all. Plant quarantine, just to give a little background information in terms of our connection. This is a whole slide, so the should have changed the Ministry of Industry, Commerce, Agriculture and Fisheries, but the essence of it does not change. So plant quarantine, we are in the Central Ministry, and we have support from Rural Agricultural Development Authority. We have support from, and these are direct support from research and development, that's Boulder Research Station. So there's a surveillance component and there's a research component to what plant quarantine does. And of course, we do have our sister agencies like the Vet Service Division that is already there. We have Public Health, we have FSPID, Bureau of Standard. They all provide support to plant quarantine when it is necessary. Of course, academia, forestry, commodity boards are also a part of our system. Okay, the systematic approach is a very integrated approach in terms of what we do and our mandate. So when we look at mandate of the plant quarantine, it's really to prevent the introduction of exotic pests from entering the country. But at the same time, while we are doing our focusing on import and the main picture is looking at exotic pests, we have a function to play with regards to ensuring there is food safety, because that quality component of our mandate is important to ensure that the highest quality food comes in, the highest quality food goes out, and the most safe food enter the country. We also have the export component, which look at the highest quality pest-free agriculture product goes out. And we also pay a lot of attention to food safety and ensuring food safety. Another third mandate I would say is assist the ministry in sustaining plant health right across the country. We have to be, sharing that responsibility with the ministry, especially when it comes on to production and productivity, what the ministry's mandate is in terms of driving agriculture in Jamaica, right? So the mandate of food safety is quite overlapped in terms of import and export and what we do on a daily basis. We have the legislation that governs our activities. We have the Plant Quarantine Act, which we are at this stage where we're now amending the act to, be more inclusive, and we'll be repealing the Agriculture Produce Act. So this one act will be the giant act that carries our export and import function once it is passed through Parliament and is approved. We'll have the regulations for, plant control regulations. This is what we use to govern import and export on a daily basis. We have our citrus protection regulation. We have the solid wood packaging material regulation. These are for pallet or wood packaging material that people ship on a daily basis. We have another regulation that is coming very soon, and that is clean seed and nursery regulation that will be coming shortly in our midst. Don't want to spend too much time on the regulations, but the essence of it, we have our legal ambit that we work with to keep our country safe, right? I just move in terms of international agreement and how we function. We have an international body. It's called the International Plant Protection Convention. We're an adherence member, and we work with what is called international standard for phytosanitary measures. Now, these are standards, and there are about 45 of them that we look at these standards to implement our daily operation, our responsibility, our role and responsibilities in Jamaica. We look up to these standards to implement our action and the way we do business. There is also the function of Codex Alimentarius, and my fellow colleagues would have mentioned Codex in their presentation, especially Dr. Susan from Vet Services Division would have mentioned so much about the involvement of the Vet Service Division in Codex Alimentarius. We are also signatory to the WTO, and we ensure to keep the obligation of the WTO and the SPS agreement alive by ensuring that we do not what you call it now, misuse or violate these agreements at any point in time. So when you look at the structure, you will have the IPPC, you will have the animal health, and then you will have food safety, which is Codex that we're a part of. You may be asking the questions, since we're heavily focused on plant health and pests and disease, or pests, and quality, how do we ensure we have maximum food safety? How do plant quarantine ensure we have food safety in the country, maintain food safety or keep food safe in the country? What our involvement? It's easy to say that, you know, I would have mentioned earlier that plant provide over 80% of the food we consume, and of course it's nutrition for a livestock industry. But at the same time, plant is responsible for a majority of the diseases that we are facing. It's a lot. The presenter from BSJ would have provided some statistics in terms of the number of people got sick on a yearly basis, over 600 million, and over 400,000 plus dying as a result. And interesting to say that of this 600 million people that get sick on a yearly basis, 40% of the 600 million are children under the age of 5, right? And that is in the region of over 100,000. So that is very alarming. So that's why we have to have such a key interest in maintaining public food safety, because it is a public health risk. It is a crisis if we don't manage it properly. The plant quarantine branch in our day-to-day activity ensure food safety through our certification process. So we have packaging houses that are certified for export of agricultural produce. And within our packing house guidelines, we have structural requirement, we have flow process requirement, procedural requirement that must be maintained for the soundness and maintain the cleanliness of the operation. We have things like, you know, a facility cannot be operating on wood surfaces. So if you're going to put produce on wood surfaces, we say no, that's not allowed. You need to have stainless steel. We also, you know, wash tanks and bins should be made of stainless steel or plastic material. Your structure should be made from material that can be easily cleaned, like concrete wall. You know, metal sheeting wall. You know, if you're going to use plywood and things like that, they're going to be hosts for microorganism and breeding ground for fungus. So we try to ensure that these things are not in packaging house that going to elevate any form of stress on the food industry. Food-based operators must ensure that they comply and follow the guidelines. And so we have good manufacturing practices handbook that we have established. This was published in 2018, and it is a useful book. You can find it on our website. I've provided the link. You can find it on our website, and it's, you know, if you like to read online, it's a good read online. But if you want to print it down, you can also print it down. It's free and accessible. So it's provide a good systematic approach to food safety, or how to maintain your facility to prevent foodborne disease from entering the facility. At the plant quarantine, we also do frequent packing house monitoring. So on a daily basis or quarterly, whichever we choose, we schedule it to how it suits us. And we'll go to these packing house and check to see what the operation is like. We want to know if a company say they're going to pack breadfruit. This breadfruit is not being packed in some bush and then comes to our export complex for export. We want to know that breadfruit is being prepared in the packing facility. We want to know that peppers are not placed on the ground. Remember, pepper it could be considered a finished product. It's something that you can just take up and eat. Same for mangoes. You just probably have to rinse it off and you go ahead and eat. So you can imagine if a pathogen enter the structural membrane of these commodity and enter the flesh area and cause pathogenic disease to enter your body. You know, this is the way that most people end up get sick. Food that are on the ground and so forth are, you know, adulterated food entering the food chain and get to the market, and people consume it and get ill. So we have to be careful that we don't have people packing outside of the rule that is established for them to keep the food safe. And that is very important for people who are operating food-based businesses and even home. You know, you're at home, you need to know as well how to protect yourself. We do yearly packing house audits, so every year that we actually enter certify them. They are once they have maintained the integrity of the facility, we'll recertify. We do sample collection, and this is work with public health pesticide control authority section. Well, the Ministry of Health, the pesticide control authority section, and we collect samples. So for import, we'll collect samples of grape, we'll collect samples of strawberry to run what is called MRLs to see what type of chemical they use to treat these commodities, and if there's any adverse findings or, you know, any illegal substances that are showing up on our import. Because we don't want any of our people to actually get sick here. So we'll do that. We actually take action, and we are very, very active when it comes on to taking action. We work with the recommendation of public health. So if there's a foodborne crisis, you can remember we have issues with lettuce in the United States, iceberg lettuce, romaine lettuce. And of course, we have issue as recent as 2020, we have onion, or I think it was an E. coli outbreak in onion in the US. And we had to take action to prevent these international products from entering our border and contaminate or industrial cause serious illnesses. So it's very, very important, and we respect the fact that we can collaborate with different agencies to bring out the best in us. Our activity of protecting the country from foodborne illnesses is not a one-man show. It's not a one industry show. It's a everybody's business. right? So we want to emphasize on that one. We work with Codex. In plant quarantine, we have actually three Codex Alimentaris committee, food-based committee. One is for fresh fruits and vegetables. And this committee deals with any standard relating to, vegetables and fruits in the fresh form. We set standard for these products. And recently, we have set a standard for yam. We have set a standard for ware potato. You know it as Irish potato. We have also set a standard for garlic, and there's a standard for pepper. There are so many standards. So if a food-based operator or any exporter want to know where to go and find standards that they can help to improve their business, you can go on the Codex Alimentaris website and look for standards, and you will see the different standard that may be relating to your type of operation. The spice industry, we have a committee on spices and culinary herbs, and this committee recently draft a standard for ginger, nutmeg, and basil, and there are many more. They are doing even a standard for turmeric, cumin, coriander, so many different. Pimento is coming soon. So the spice industry, you will have something to work with. And what we try to do is involve the industry. When these standards are being developed, what we do is try to get the industry involved to say, look at these standards. What are you seeing that jump out at you as going to be a trade blocker for you if you wanted to send your nutmeg overseas, send your ginger powder overseas? Would this standard hurt you, right? And if you're an importing country, what you look at when these products are coming to you, you have a good base point to look at. And there's this big committee called the Import, Export, Inspection and Certification System. This committee actually deals with, guidelines, principles and guidelines on how you go about exchanging information between competent authorities. So like plant quarantine want to talk to the plant quarantine in the US. There's a channel for us to discuss issues relating to food safety, issues relating to plant health and so forth, and animal health. We have schemes that are third-party voluntary schemes that are coming now, where a group of people can decide that they want to get together and start this scheme or this club, where it deal with certain aspect of the food-based operation that they are in. It could be that they want to get accreditation. Matter of fact, getting accreditation for this type of scheme is very important for the industry because it will help you to actually export into new market. And of course, the food-based operators, the competent authority in Jamaica will look at these food-based operators are, a place that is business that are conforming to good practices, best practices. So this scheme could be a scheme takes care of certain sampling procedures, right? Certain testing and so forth. And the result from these schemes, the competent authority could look at it and say, look, we have seen where you test some yam or meat product for salmonella or whatever the disease is, and the result come back clean and nice. And we could use this information to put on our system and of course help in the whole certification process. We are going paperless in Jamaica, and we have developed guidelines for paperless certification. We are in the age where a single window as a CUDA is coming very strong, right? And these are, a single window will be a certification-based system, and a permit issuance system, license and permit and so forth. And this is good because we are no longer in the age of paper where we constantly writing documents and it's taking up so many time. People losing money, document get lost, people can fraudulently change features and the certificates and so forth. So when we talk about paperless process, we're talking about real-time movement of information through an electronic form, and that is very good. System equivalence is another big one on the ticket where people can actually, if you want to go into a new market, And there's something prevent you from entering. Say, for example, you wanted to send meat into US, but going into that market, the US probably have a system where they treat meat by, say, irradiation over there. And in Jamaica, we have a system where we use to treat meat. Probably we use a chemical process to treat our meat in Jamaica. But US actually, because they have an irradiation system there, and we have a chemical treatment system, they are saying, look, we cannot take your meat. You have to have an irradiation system. Well, this guideline is actually telling you now that if you compare irradiation and you compare chemical treatment, and they are balanced in terms of getting rid of the pathogen that we're worried about, and not only that, but also you have the food maintain its characteristic and its safety. The food maintain it's safe to consume. It's not going to provide any adverse impact on the health of consumer or any animal. Then this is the tool to use, and it is very beautiful, you know. Other agents that we continue to work with in the international platform is USDA, FDA. We also work with Canadian Food Inspection Services. We work with EU. We also work with the UK authorities. This brings me to the point where if you need to get in touch with Plant Quarantine, I started from the top where you can get in touch with our Chief Plant Quarantine Inspector. You can also speak with me, second in line, and then we have the inspectors, the compliance managers, and the export complex manager. Of course, we have our risk assessor there as well. But this is a list of, the management team in Plant Quarantine that you can get in touch with at any point in time for more information and so forth. Colleagues, I just want to emphasize the importance of food. Safe food today, we want to maintain this safe food. We want to have safe food tomorrow in the future. We want to ensure that safe food is everybody's business. And we want to keep that as a practice. We want to have it in our practice, in our operation. We want to memorize it, right? That the importance of safe food cannot be ignored, and it can only make you an healthier person and make your business even more healthier. That's the end of my presentation. Any questions I will be happy to answer. Thank you very much.
Thank you very much, Mr. Rowe, for your presentation. And we'll be taking questions right after this presentation. We're going to go back to presentations from the Ministry of Industry, Investment and Commerce. You can stop sharing now, Mr. Rowe, while we prepare to hear from Mr. Lentworth Clark. So Rowe, you can stop sharing the screen so that we can have, thank you very much, that we can have Mr. Lentworth Clark. He's from the National Compliance and Regulatory Authority, NCRA. And he's going to share his presentation with us. You can go ahead, Mr. Clark. Thank you so much.
All right, thank you very much, everyone. It is 2 minutes to 12, so it's actually morning. So good morning, everyone. As the host says, that I'm Lentworth Clark from the National Compliance and Regulatory Authority, and I'm here today to speak about the role of the National Compliance and Regulatory Authority in preserving the safety of Jamaica's food. But before I get into that, yes, we are a statutory body. We fall under the Ministry of Industry, Investment and Commerce. And just like the Bureau of Standards, our acts that we use, the Standards Act, the Processed Food Act, and the Weights and Measures Act. There has been some change, as my colleague from the Bureau stated earlier, where the Bureau is now a facilitator. So the regulatory division of the Bureau of Standards has now been removed, and we are now a new entity called the National Compliance and Regulatory Authority. This basically is where the inspectors are. So we are the regulator. And this happened through a cabinet decision in 2015. However, the institution was established in 2016, where the National Compliance and Regulatory Authority assumed and performed the regulatory function previously undertaken by the Bureau of Standards. I hope this is clear. I would also like you to share this information to anyone, so you can see the clear disparity or the clear functionality between the NCRA and the BSJ. As my colleague said earlier, they are now a facilitator. We are the regulators. At the NCRA, we have 3 inspectorates: the Food Safety Inspectorate, or Import and Domestic Commodities Inspectorate, and our Legal Metrology and Petroleum Inspectorate. As you can see, we regard food safety as extremely important. Hence the reason we have an inspectorate just for that. So we deal with food safety in that inspectorate. You have the Import and Domestic Commodities. They are the ones who conduct inspections at our port of entry and also in our retail outlets. The Legal Metrology and Petroleum Inspectorate, they conduct inspection or testing and verification of weighing and measuring devices, like when you go to your gas stations, or if you go to your supermarkets and you see the scales, or in processing plants. We verify those scales that they use. We have our core values, what we call care, integrity, confidentiality, accountability, impartiality, respect, and excellence. You can actually go on our website and you will find all of this information, so I won't necessarily go through it. You know, I'm confident that everyone here, that whenever you consume food, you'll prefer to be that emoji on your right other than the one on your left. You don't want to be sick whenever you consume food. Also, if I ask you the question, would you consume any one of this food? I am confident that the answer would be no. We have already exhausted some of these in terms of maybe what a food is. We consider food any substance, whether processed, semi-processed, or raw, that is intended for human consumption. And it doesn't include cosmetic, tobaccos, and substance that is used only for drug. And again, we have exhausted what food safety is. I don't necessarily have to go through those again. So getting to the main point, what our roles is in food safety as the National Compliance and Regulatory Authority. What we do, we conduct inspections both in the domestic market and at our ports of entry. And this is done by registering food establishment using the JS36, which is a Jamaican standard specification for processed food in general. For the year figure, the last year, we conducted 653 inspections in terms of registration. You do have 830 establishments. Sometimes they might not be producing, hence the reason we didn't conduct the entire 830 of them. But our compliance rate most of the times is over 75%, where we have over 75% of establishment registered. We also conduct routine inspections where it can be announced or unannounced. And the last year, 2021, we conducted over or close to 900. To be exact, we did 883 of those inspections. We also conduct inspections at retail outlets, and we also conduct inspections at the ports of entry, like our berths, airports, and cold storage site, etc., etc. We take food samples for testing. This is to ascertain if the food is free of contaminant, and also we also take them to see if the chemical properties are true of that food. The last time our food inspectorate division, last year I should say, we took just over 900 samples. The units equate to 2,789 samples that we took. And what we do too, whenever we take these samples, is that we provide feedback to our clients. We also take samples of labels, because label is very important in food safety, to ensure that they are in compliance with our CRS 5, and CRS in this case mean CARICOM regional standard. And as you can see, the long name for it is the Jamaican Standard Specification for Labeling of Prepackaged Food. So we are the entity that is responsible for labeling of food. I made mention of this earlier. We analyze and interpret test results and to provide feedback to our clients. If it is satisfactory or unsatisfactory or even undesirable, we ensure that we communicate all of this to our clients to see if they can get adjustment to whatever parameter. And we state the parameters that are not met. We also certify food by preparing certificate of approvals, and these are mainly done through meat products like cured meats, canned meat, sausages, frankfurters, among some other foods. We continue to play a role by conducting testing and certification of weighing devices. In this particular case, we're talking about the scales. And what we do is to verify the accuracy of these scales, especially when it comes on to the ingredients. And as you can see on screen, we're speaking particularly to preservative, because as you, I'm confident that you can appreciate, too little preservative can lead to unsafe food, and also too much preservative can lead to unsafe food. If you have too little preservative, you find that the product might start to deteriorate before the date of minimum durability, or what we consider as the best before date. And if it's too much chemical, it can be poisonous. So it's important that your weighing devices are tested and certified. We maintain a strong enforcement program. So we withdraw products from sale that breach any standards or regulation. We also do seizure and detention of food products that are not in compliance. And we also do condemnation of food that is not fit for human consumption. We investigate complaints, whether provided by Consumer Affairs Commission or any client or anybody from the public in general. From once you provide, there's a complaint, we conduct our investigation. We also assist in the development of standards or regulations or even codes of practices. We assist by being active members of the National Committee on whatever standard that is being developed. Currently, you have the JS36 being revised and the CRS 5 is being revised. So we are active members of those committee. We are also active in Codex. Other roles, we provide technical assistance to various key stakeholders, to ministers, ministries, agencies, food processors. We do not necessarily, when it comes on to the food processors, we don't necessarily go in depth. We just provide guidance as it relates to the regulation that they should, or the standard specification that they should be following. If they require further advice, what we do is recommend them to the Bureau of Standards, where they can get a hand-holding advice from the Bureau of Standards. As I said earlier, they are now the facilitator. We are the regulators. And I know, again, you can appreciate that we cannot go facilitate, help you out, and then come again and regulate you. We assist in educating the public like what we're doing now. Yesterday, for example, we were at JS Think Tank and this webinar. We do tours We do training programs, workshop, and we do awareness sessions. Lots of presentation we have done. Because of the COVID, we resort to having online training most of the time. And I think for the last calendar year, we did maybe close to 20 of these presentations. In conducting our inspection, these are some of the things that we look for, and this in particular, speaking about our local food processors. We look at the external environment, the building, we look at your sanitation, the records that comes with it, the employee's facility, pest control, and you can go ahead and look on your screen to see what we look for whenever we are conducting an inspection. And as I said earlier, especially at our processing facilities. As you know, we are the ones that are dealing with food labels and what should be on your label. And I'm just going to take you through this briefly. And I give definition of what a label is, and these definitions are located in our CRS 5 and what labeling is. So there's a difference between label and labeling. You can go ahead and read same. But what is the importance of labeling? Is to advertise a product, to distinguish a product from the competitors, to establish a brand. But for us, it's important to provide customers and consumers with information on a product. And it is a legal requirement. So you need to ensure that if you have your product, it is compliant with CRS 5. And I'm just going to take you through, just briefly through it. Is a good sized document. So I'll just take out some of the most important thing. You can share this with other persons. What the standard is applicable to the labeling of prepackaged food to be offered to the consumers or for catering purposes. And it also tells you here what it doesn't apply to. So unsold, unpacked, or in open or uncovered packages is not applied to that. If you're weighing or measuring over the counter in the presence of the processor or the consumer, this standard is not applicable to you. If you're exporting only, it's not applicable to you. And if there's a regional standard that exempts you, it's not applicable to you. And if you have gift wrap products, this standard is not applicable to you. These are some of the requirements that is required: the name of the food, the list of ingredients, and the list of ingredients here must be in descending order. The net content and the drain weight should be there, and that is where, if applicable, not all products will have drain weight. The name and address should be there. No PO box should be. Country of origin. So even if you have 19 Hope Road, Kingston, Jamaica, the standards require that you have a country of origin. Lot identification should be there. The date mark and storage instruction should be there. And your instruction for use should also be on your labels. Again, your lot identification, and these are just some things that we saw that happens. As you can see, the picture, the one that is on your right is not correct, but the one on your left is, where the code, it should be permanently coded at all times. And also under JS36, it tells you that the letter or number assigned to your establishment shall be at the beginning of any identification code used in relation to that establishment. So we look out for these things whenever we conduct our inspections. And this one goes to tell you what not all products require a date mark. And they're saying this, so just in case you go there, you see some products that do not have date marks, they might be saying, but why they don't have an expiry date? Not all products, based on the standard, required to have date marks. And they tell you some fresh fruits and vegetables, your wines, your liquor, beverages containing 10% or more, products that will be consumed, as I said, bakery products that will be consumed within 48 hours of manufacture. Don't necessarily need to have a date mark. And it gives you some more vinegar, food grade, chewing gum, spices, or if you have other products that are permitted by the standards body, national standards body for exemption. For the future, as I said, we are still using the Standards Act, the Processed Food Act, and the Weights and Measures Act, because the NCRA is not a standalone entity as yet. So for the future, we are waiting on our legislation, which is the NCRA Act of 2020. Hopefully by this month we can get to do with the ISO 17020 implementation. Training has been done for most persons already. So this month, I think we will be signing up for this standard. We also see we're involved with Codex. They're trying to deal with the sweetened condensed milk and evaporated milk. There are also the suggestion as to develop standard for milk alternatives industry. They're also revising the jerk season and jerk sauce standard. And there's also a review of the GIS 36. I can say to you that there's also a review of JSCRS 5, and because at this time, nutritional facts in Jamaica and the CARICOM region on our own is mandatory. What they want to do is to have a change where the it's not mandatory. So what they want to do is to have a change where the nutritional facts is now mandatory. For further information, you can visit our office at 19 Hope Road. We have regional offices, so we share the regional offices same way with the Bureau of Standards. One is in Montego Bay, one is in Mandeville, one is in Ochirais, and one is in Savannah Lamar. If you want to know again about the standards, you can visit the Dr. Hartman Henry Standards and Technical Information Center. We call it the library here. We are up and about. We have our website, www.ncra.org.jm. You can email us at info@ncra.org.jm. We are also on WhatsApp, as you can see there, 87628-289-6272. Visit us on Facebook, Instagram, and Twitter. In closing, we here at the National Compliance and Regulatory Authority join this global campaign in observing the third staging of the World Food Safety Day. We endorse this year's theme, Safe Food Now for a Healthier Jamaica. We also see the slogan, Food Safety, Everyone's Business, where farmers, transporters, processors, vendors, importers, exporters, regulators, and consumers need to be conscious of food safety practices, I should say. We consider that fit for purpose. I thank you. If there are any further questions, I'm here to answer as it relates to the National Compliance and Regulatory Authority.
Thank you very much, Mr. Clark. Thank you for that informative presentation, and thanks to all the presenters from the Ministry of Industry, Investment and Commerce. So at this time, we're going to take questions from the attendees. Any questions or any comments? And I'm seeing here Paul is off, our faithful commentator. If you have any questions, you can use the raised hand feature. And Paul says, we appear to depend on media informal reporting for food safety issues rather than official reports, such as cases from the US, Canada, and EU. What are the reasons for not having a specific local data, for having specific local data for food safety issues, given the robust regulatory system, standards and system that are in place? Is it a case of shielding the guilty, or is it a manpower resource issue? I'm not sure which one of my panelists from this segment can respond to that. He's asking, what are the reasons for us not having a specific local data concerning food safety issues? Should I ask Mr. Yes.
Sorry, I had presented some of the statistics, so I think I'd like to try to provide a response where that is concerned.
Sure.
Data does exist, but I've seen in perhaps 2 publications, one from the WHO and there's another one from research that was done by local researchers at University of the West Indies and other local agencies, where basically they're saying, while it is happening, a lot of times a part of the problem is under-reporting of issues. So persons are having the symptoms, they're having the issues, but they're not going to the health institutions or not making the reports. So if that is not happening, then you will not be able to have certain data to be able to have the kind of documentation that is necessary. So I can't speak to resource, and I think it would be a dangerous practice if it were a case of shielding the guilty, but certainly some things would indicate that we're not having the kind of reporting that would be necessary to have some kind of a robust system. Additionally, there's some information or a report that would suggest also that perhaps the levels that we may be experiencing in Jamaica and by extension some areas of the Caribbean may not be so very prevalent. Can understand that it is still important. So I think these are some of the things that I saw in relation to the reporting and perhaps why we don't have that kind of a system.
All right, thank you. Thank you very much. We have a raised hand here. O'Neill, you can go ahead.
Good morning to you all. I'm asking a question. We have overlapping, most of the agencies that have presented have overlapping responsibilities as well as requirements and standards. When will there be uniformity of all these standards compiled?
All right, thank you. Which one of my panelists want to take that on? Mr. Clark?
Hi, I'm here.
You heard that question. Do you have a response?
I don't necessarily have a response in terms of saying definitively when the harmonization of all standards will come together.
Right.
However, I know that there is a committee that has been established to look into such matter, because this has been a concern of many persons, especially the processors, because depending on the product that you do, some persons have complained that sometimes they have to see 5 agencies upwards in order to be compliant with the local regulations. As I said, I can't give a definitive answer, but I know that there is a committee that has been established to look into the matter of such.
Mr. Leonard, I may be able to provide some assistance as well.
Right.
So the committee that you have mentioned is actually far advanced in develop what is called the inspection matrix that separates the different border regulatory agencies function. So where they are overlapping, what we try to do is to separate that. So for example, plant quarantine and FSPID inspecting the same commodity, right? So we inspecting fruits and vegetables. What we do is look where the plant quarantine has more expertise in, and we are the competent authority, say, for fresh fruits and pest related matters on fresh fruits and vegetables. And for FSPID, they would look at things for relating to say grains and food storage kind of thing. And they would have more expertise and competence in doing that. And what we do is to separate the functions. So we don't have to be going out there and doing what they do, and they don't have to be doing what we do. What we do is have a mechanism in place where we communicate with each other. So if they are doing an inspection for plant quarantine, they'll provide us with the report, and we do the same. In terms of standardizing regulations and so forth, each specific agencies, we do have, as I would mention earlier, we do have competence in certain areas. So for example, the vet services division, they would be responsible for animal health related matters, and plants would be related to plant health matters. So it would be difficult for you to have those two standards coming together, or those two regulations coming together. You will always have that separation. And we don't necessarily have that commingling in terms of what we do out there. But I can understand from public health standpoint, public health agencies or NCRA and FSPID, there might be some slight overlapping in relation to FSPID. And what we have been doing at the Committee for Business Review is to try and separate these overlap as much as possible. And we're far advanced in that activity and should be able to implement it once we have completed all the training and the sampling protocols that are required. That should be implemented and be in place.
Thank you for trying to answer that question, but there has been some disparity in the standards as it relates to the shipping companies or those companies that does export, as it relates to what is required of us and meeting the necessary standard as it relates to the global sphere and the international what should I say, platform, that they have to do the necessary exporting. Yeah.
Mr. Brown, probably what you could do, in terms of giving a little bit more clarity, you could be a little bit more precise in terms of what you speak about in terms of standard overlapping in the shipping industry. That would be specific. You'll hit the nail on the head. The specific BRA can say, okay, this is what you're talking about, and provide that suitable answer for you.
Okay, we'll do so. But as it relates to that, I think based on dealing with certain exporters, they are having challenges as it relates to the overlapping standards of most of the agencies who have.
Could you say what type of export, Mr. Brown? What type of export? What the commodity?
Plant as
products.
Well as, yes, plant products as well as animal byproducts.
Okay. All I know for plant products, there is two agencies right now that I think would be two border regulatory. Well, one is not really a border regulatory agency. I know for plant quarantine, we're heavily involved in the certification of plant products. Then there is JACRA, Jamaica Agriculture Commodities Regulatory Authority, that deals with specific commodities such as pimento, turmeric, and so forth. And recently we have been having a little bit of challenge with turmeric. because exporters have been complaining that, look, we are registered with plant quarantine, we have gone through the whole jumper process, and now there is a new kid on the block. JACRA is giving instruction as to how to say, you know, you need that document here, you need a license from them. What we have done is to sit around a big table and have a MOU in place. So the MOU is actually about 90% completed. And we also have a ministerial intervention. So the minister would have given certain instruction and make it very clear as to who will do what process. And there will be no introduction of any new fees or anything in such case of certification for export for these commodities that are overlapping commodities where you have two regulations dealing with the same type of product. So there are some things that are coming. They are not fully in place as yet, but we are not far away from implementing them to make the atmosphere a bit smoother. And I would have already mentioned about the matrix, the inspection matrix, the profile of how to separate the different BRAs in terms of moving away some red tape, moving away the double inspection and all of that. That is coming. So I can assure you that in coming probably a few weeks or so, for a month or so, we will be announcing what we'll be doing to ensure we have reduction in this type of practice.
All right, thank you very much. We're going to take a quick question from Desroy Nelson. He's asking, how is the roles and functions of the FSPID inspectors different from those of the NCRA Food Inspectorate?
Yep.
Okay.
Thank you very much.
Morning.
Okay.
Again.
Go ahead. Hey, what's up, Hoffman? Go ahead.
Okay, so the FSPID roles and function, I'll talk about FSPID and then let Mr. Clark can maybe talk about NCRA. For FSPID, our acts and regulations, we are responsible for inspection at the ports with container inspection, and we also do premises inspection and cargo ship for animal feed, raw materials for like the wheat and stuff like that. And we have a compliance certificate program for premises inspection. We look at premises for the storage area, whether it be dry storage or cold storage, and we look at sanitation of the premises. We do not look at sanitation for the workers. Sanitation is for the premises and how the food is stored. We also, in terms of mitigation of loss, food loss, we do disinfestation activities. So we do like our spraying of food entities, if needs be, and also fumigation activities. And the fumigation extend to all the export commodities that is leaving the island to be fumigated. FSPID is responsible for those. And we also check for incoming commodities to see if they were treated before entering the island. So we check like for fumigation certificates, especially for our infestable products. So our grains and cereals must be fumigated before they enter the island. And those leaving as well, fumigated before they leave our shores. That's basically it. So I don't know if Leonard want to tell in terms of their end.
Sure.
And we in terms of food premises, sorry, Leonard. In terms of food premises, we go in anywhere food is stored, processed, for sale. So that's the reason I originally list out the different places. So many different food entities. We even inspect the prisons, their canteens, the schools, the canteens, the factories, the distributors, the supermarkets, the restaurants, bakeries. So all of those places in terms of anywhere food is for sale or stored or manufactured. All right, Mr. Clark.
Okay, thank you very much, Ms. Hoffman. So our function in terms of the NCRA's Food Inspectorate, we mainly focus on the process that happens at the food processing establishment. So we don't necessarily, in the Food Safety Inspectorate, goes anywhere else except for the processing plant. Our import and domestic commodities inspectorate are the ones who conduct inspections at our ports of entry. And as I said, within the domestic market where we have our retail outlets or supermarket or gas station or wholesales, etc. So as I mentioned, the Food Safety Inspectorate, our main focus is to go in and validate the process from raw material straight until it reach in its primary container or even secondary containers. And we also check the labels on those containers. So if you have any product that you have you're processing we will go in and we look, as I said, from the raw material straight until it finished. So if you have water processing, we are the ones who validate the entire process. There's no other organization that does that. If you're doing canned artisan brine, it's the same thing. We validate that entire process. If you're doing biscuits, baked goods, we are the ones who validate the entire process from raw materials or ingredients to its finished goods, and we also look at its container. Our standards might say that the area should be pest-free. Pretty much that, it says. So we just look to see if there's any pest. I think FSPID look a little bit deeper than us when it comes down to that. You probably have other overlapping functions, as persons might say. So the Ministry of Health, they might go in and they are looking deeper into sanitation. We are just basically looking to ensure that the area is clean and, you know, as I said earlier, free of pests. But I will just say it again, our main focus is on the process, to validate the process that is happening at a food processing establishment.
All right, so let me add a little to that, to what Mr. Clark said. So as he said, NCRA is about the process. We know, look at the raw material before NCRA deal with the process. So the raw material that comes in, we inspect at the port of entry. On the domestic market, when we inspecting, we also inspect at the raw material as well. We might look at the processes, but we don't go into detail as the process like the factories. We look at how the raw materials are stored, and we also look at the end product, how it is stored. And as he said, we pay close attention to pest infestation, both pests and pets. So in food businesses. So as we said, we have an entomology lab. So we take samples, and the lab would analyze the samples. We have 4 testing labs: the microbiology lab, the rodent biology lab, the entomology lab, and the pesticide residue. So if, for example, we say we take sample on fruits and veg, the pesticide residue lab can see test in terms of how much pesticide residue might be on those fruits and veg, or any other commodity as it may be. So the entomology lab will deal with whatever pests that may be in the commodity. And as we said, we do in terms of sanitation of the premises. We don't look at sanitation in the individuals, the workers. We normally publicly look at the workers. So the premises, to ensure that there is no pest, like a rodents or any other stored product pests that might be present in the commodity or on the premises.
All right, thank you so much.
So just an example.
Quickly, Mr. Clark. Yes.
Okay. So I conducted an inspection at a facility, and during my inspection, I recognized that there was significant amount of pests, weevil to be exact, significant amount. All I can do probably under our regulation was to detain the product. whenever we see things like that, what we have to do is to turn that over to FSBID, because it was that significant amount of pests that we see there. Just to give an example of how things go sometimes.
All right, thank you so much. So we are entering our final sets of presentation, and these will come from the team at the Ministry of Health and Wellness. But of course, we have more giveaways. I want to give away quickly 2 questions. I want you to use the raised hand feature to answer this question from this segment. So how many children die globally? I think this is a WHO number. How many children die globally from eating contaminated food? Anybody remember the number that was given? All right, I see a fast hand here. Dave?
I think it was 5% of the global population. I think it was 125,000 children yearly. I remember in fact.
Yes, correct. That is correct. Excellent. All right, and another question, the final question. There was a ratio of the number of persons who die globally. What is the ratio? Not just children, but overall, adults, overall. The ratio, according to the WHO, of the number of persons who die from contaminated food. Anybody know that? Dave, I'm going to give somebody a chance, right? I'm going to give Karen. Allow Karen to tell me. Karen? Karen, you can unmute. I see your hands raised. Yes, Karen, tell us. You're both hands raised, but you tell me. You're not hearing me. Go again. 1 in
10.
1 in 10. All right, excellent. Yes, that is correct. Just write your name down. Renee, you're gonna make contact with these persons.
Karen, that is not Karen. This is Rebecca Nelson Brown.
Is Karen name? Is it come up, you know?
I don't know.
Rebecca
Nelson Brown.
Nelson Brown.
Yes, I answered that question.
Okay, thank you so much, Renee. Just making note of these winners, and we'll get in touch with you for your prize. All right, we're gonna go now to the team from the Ministry of Health and Wellness, and our first presenter is Mr. Colin Cooper. I know we are behind time, but the team will help us to make it up. So Mr. Colin Cooper is the environmental health specialist at the Ministry of Health and Wellness, and I'll invite him at this time to share his screen and to make his presentation. Mr. Cooper.
Are you seeing the presentation?
Yes, we are.
Okay, good afternoon.
Can you put it in presentation mode? From beginning, yes.
Okay.
Yes.
All right, good afternoon, colleagues. Good afternoon, ladies and gentlemen. I was trying to find the raise hand feature to accommodate a few of the questions, but I can address some of those after I would have completed the presentation. Thanks again for joining us in the celebration of World Food Safety Day. And I will be doing a short presentation on the regulatory roles and responsibilities as it relates to food safety and protection with the Ministry of Health and Wellness, specifically looking at the Environmental Health Unit and Veterinary Public Health from the respective public health departments. Now, regulatory food control in Jamaica is the overarching purpose of food control regulations and other government food safety interventions is to minimize the risk of foodborne illnesses. Just to remind us that the structure of the health system in Jamaica it's decentralized. So we have 13 parish health departments that functions to deal with the operational aspects of the task. There are 4 regional health authorities that looks at the implementation of policies, and 1 head office where you have the policies, laws, and regulations, monitoring and evaluation on other such activities are done. The components of the food safety program in the Ministry of Health with respect to the environmental health unit, the public health departments, are pillared on 5 main areas. 1, food laws and regulations. 2, inspection and auditing. 3, food control management, laboratory services, and finally, information, education, communication, and training. Now, these 5 components are integral, and they are attributable to the respective regulations that we have to enforce. The legal framework, therefore, comes as a result of the various acts and regulations, policies, guidelines, and norms and standards. So some of these standards would come from Codex Alimentarius, other policies and guidelines that would have been developed by the Ministry of Health and Wellness, and the various acts and regulations that you might see, that you will see on the screen. Main act would have been the Public Health Act, and you have the attending regulations there. Butchers, meat inspection, tourist establishment, nuisance, food handling, and some other standard guidelines and procedures. Now, this is what gives the basis for the action and the respective activities to be done. Let us look at inspection and auditing. And remember, I'm giving you a very brief perspective. Here, we do inspection and certification of all food handling establishments. And this is a process through which these entities have to apply. And from the application, it causes an inspection to be done based on the particular parish in which this facility is housed. The same would have applied for 2, inspection and certification of tourist establishment. Some of us will call them hotels, but we don't use that term because there might be some challenges with that definition. But tourist establishments are so defined in that particular regulation. You have inspection and auditing looks at food inspection, where you have that relationship for imported food. You have it for local food. You have it for food that is for export, especially the veterinary public health officers who does that with respect to the seafood factories and facilities, and that is done in collaboration with Ministry of Agriculture and Fisheries Veterinary Services Division. Persons were asking about overlaps. Yes, with respect to imported food, again, there are some where a permit has to be derived from particular entities, but the inspection component is conducted by the public health, respective public health officers at the main ports and the airports as it relates to that situation. Locally, where food is, anywhere food is handled, anywhere food is stored, anywhere food is processed, anywhere food is transported, you'll find that the public health intervention is necessary in order for it to attain and maintain the requisite standard for it to be considered safe, sound, and wholesome for consumption by the or utilization by the public. Inspection and certification of meats and other foods, and this is done on a regular basis in various parishes based on that particular regulation that is there for these situations to be, or these activities to be caused. For the establishment, this is a copy of what the license would look like, and it is under the Public Health Act and the Public Health Food Handling Regulation. And as the law says, it should be placed in a conspicuous position where the public should be able to see. It it has a duration of a year, and it will indicate an expiry date on it, so the public can be informed if the facility has met the minimum public health requirements and therefore has attained this level of certification. Laboratory services plays a critical role in whatever we do as it relates to food safety and protection. The officers, public health inspectors or environmental health officers has the authority to take samples of food items for examination. Necessary action is also to be taken if the results indicate that the food is contaminated. Examination of records, if the facility has an in-house laboratory, is part of that process also for us to ensure compliance with the respective regulatory requirements. Information, education, communication, and training under the law. The public health departments is authorized to educate, train, and certify food handlers. And there are different requirements for food handlers as it relates to how they should operate, what happens if they are ill, what ought not to be done. All of those conditionalities are outlined, and they would have to sit, do a test, because there's an educational component, and there are certain standards requirement that they would have to meet as it relates to the examination aspect. They would also be subjected to physical examination. Medical examination can also be conducted if necessary, and the medical officer of health, which is the person responsible for the health of the parish, is authorized under the Public Health Act to conduct those necessary interventions and examination. The food handler's permit is valid for a year, 1 calendar year, and it can be revoked if the holder is found in breach of any of the requisite guidelines or regulations through which it was approved or delivered. And this is what a sample of the electronic card would look like. There are still some areas where the paper card is used, but we are moving to have that standardized, so you would have an electronic card, something looking like your driver's license, which would be much, much more easy to handle and manage in this current situation. Food control management. Here, recommendation is done for the approval of appropriate food control management systems for use in the food handling establishment. We go again with good agricultural practices or good food handling practices, hazard analysis, critical control point systems, preventive controls for human food, systems like those. is appropriate for use in some of these establishments. It is critical that they have appropriate records and documentation indicating what ought to be done, what are some of the corrective actions and situations like those through which we would use to determine whether or not it would meet those requirements. As part of this process also is the investigation of foodborne disease outbreaks and events. From here, wherever this situation do occur, it feeds into a system, the National Surveillance Reporting System, that would capture some of this information. Normally, a rapid response team would move in to do this kind of investigation, incorporating not only the public health inspectors, but would also incorporate nurse, laboratory persons. It's a team approach. Clinicians, all of those persons would be a part of this process. And then the report, and from that investigation, consultation, and collaboration will be done with the other supporting entities or supporting agencies, such as veterinary, the veterinary division, or plant quarantine and plant quarantine and inspection, produce inspection unit. Areas like those, BSJ, NCRA, we do have that kind of collaborative relationship in that regard. Also to point out here that it depends on the product or the item that might be a challenge, or the being part of that causative contributing to that challenge. Here again, our veterinary public health inspectors would have been very, very critical in addressing issues, say on farm, for example, say egg, would have to go into those facilities and deem and look at what the situations are, if they have the necessary biosafety standards in place. So that collaborative work there would be done, and we'll do the necessary investigation and try to see how best we can control, put the necessary control measures in place to prevent a situation like this from reoccurring. Monitoring of facilities to ensure they satisfy the requirements as set out in the respective public health regulations. Yes, so an evaluation of the facility is done. There are some prerequisites that consider things such as lighting, ventilation, sanitary conveniences, plumbing, issues as it relates to the floor, issues as it relates to how the movement of the food or material is done from clean area into dirty area, the situation as it relates to solid waste management, handling the storage, collection procedures that are in place, excreta management, all of those situations would have been considered in the evaluation of that particular facility. As one presenter did mention that a lot of our focus is on sanitation. Recommend that the necessary control measures be instituted to ensure that the food is safe, sound, and wholesome. Food that is produced that is deemed unsafe or unfit for human consumption can be so seized and condemned and subsequently removed from the food chain by approved or appropriate methods for disposal, as recommended by Medical Officer of Health and the local health department. Records is also of critical importance in this food control management process for traceability and accountability purposes. Here, documentation have to be had for source of food, acceptance rejection criteria. Situations like those are of paramount importance in the public health inspection and requirements as it relates to the respective regulations for determining the standard that is set for us to approve or recommend the necessary measures that are needed for control in a food establishment. So, starting out with 5 components, we place them on your hands. Hygiene, inspection, analysis, regulation, and coordination. It is of paramount importance to the Ministry of Health and Wellness and the 13 parish health departments, 4 regional health authorities in ensuring that food safety is in your hands. And it is of paramount importance that we follow these principles at all times, because prevention is better than cure. And it's just a note for you to understand here. Now, I just want to point out that there is, some persons were asking about overlap. Yes, there are some instances where it might seem to be a significant amount of overlap. However, we have a technical committee established on board of regulatory agencies. That is what they are now, the entities are being referred to as. And in that regard, we're looking at the business process reform of some of these situations. My colleague, Mr. Rowe, would have pointed out that where there is a matrix that has been completed to look at how we will go about doing inspection. The more they come for how we'll do sampling, we have to do cross-training. So there's quite a lot of work being done, and it will be rolled out. He was very, very, I think he mentioned weeks. I would say some months that we'll be able to roll it out in some regards, and different components. The electronic interface is also important, the ASICUDA, and also the Jamaica. There is another site where all the requirements for importing or exporting food, the requirements are placed there. So the importer or the exporter or the producer can visit and get all the information that is necessary. So we would have been doing quite a lot of work in that regard and trying to make the process somewhat easier, but at the same time, we cannot compromise the safety of the food for just the ease of doing certain things. All right, thank you very much. Let me stop sharing. Okay. What did I write? Stephen?
All right, thank you so much, Sir Cooper. I appreciate that, your presentation. All right, we're gonna go to the Pesticide Control Agency. So you can stop sharing your screen now, Mr. Cooper. And we're gonna have with us the registrar from the Pesticide Control Agency, Ms. Tamara Morris, to make her presentation at this time.
Morrison. Yes.
Good afternoon, everyone. Are you hearing?
Yes, we're hearing you. Can you put your screen on
I'm
presentation
going to
mode?
start on the presentation mode now.
Yes, thank you.
Okay, so again, good afternoon, everyone. I am Tamara Morrison, and I represent the Pesticides Control Authority of the Ministry of Health and Wellness. I am happy to be here with you all today in sharing the Food Safety Week event. So today's webinar, I know that we are running a little late, and I will try to just run through my presentation to give you an overview of the roles and functions of the Pesticides Control Authority and how we assist in keeping food safe in Jamaica. The Pesticides Control Authority's mission statement is through efficient, facilitative, and cordial interaction with the public and in collaboration with other agencies, reduce the adverse effects of pesticides on food, the environment, and public health by improving pesticide management in Jamaica. We are a statutory body in the Ministry of Health and Wellness, and as such, we are a regulatory agency. We operate under the Pesticides Act of 1975, and we have regulations from 1996, which updates being 2011. The Pesticides Authorities function. We register pesticides for the use in Jamaica. We do approvals for the import license prior to the pesticides being shipped. We also license and monitor the sales of pesticides. So we look on pesticide importers, local manufacturers, stores selling restricted pesticides, pest control companies, certification of the pest control applicators as well. So moving on, what is a pesticide? My slide seems to be slowing down on me today. Okay, the definition of a pesticide, and this is extracted from our act. The pesticides mean any product, organism, substance, or thing that is manufactured, represented, sold, or used as a means of directly or indirectly preventing, destroying, mitigating, attracting, or repelling any pest. It includes any compound or substance that enhances or modifies or is intended to enhance or modify the physical or chemical characteristics of a pesticide to which it is added, and any active ingredient used for the manufacture of a pesticide. So you see that this is a mouthful. But generally, a pesticide is any product that controls, is represented, or manufactured in the prevention of pests. So just to give you a little bit more detail on some of what we do and why it is important, especially in food safety. The registration of pesticides is covered by the PCA, in that it's a process that involves a detailed review of the chemistry, the use, and the environmental fate of pesticides. We register pesticides for a period of 5 years, and these registrations are specific to product names and to the package size, and specific also to the manufacturer. Pesticides can be re-registered after the period of 5 years, but we again will have to review the pesticide prior to registration. So to tell you a little more on why this is important, a lot of questions come into the PCA requiring the importation of pesticides because persons would see pesticides on the free market, or they travel and they see something that is interesting to them. What it is that we have to realize, Jamaica being an island, and I'm going to call us an island state, we have to protect our users and protect where the pesticides will end up. So the users that we protect are us, as well as the crops that are being protected. And we register pesticides both for agricultural and industrial usage. Households are also covered under the registration of pesticides. So in the definition given for pesticides, you would see anything that even mitigates against a pest. So repellents are also pesticides. So to have a repellent, something you use against even mosquitoes, you would have to have that on the registered list of pesticides prior to importation. So the importation of pesticides has to be of registered pesticides for Jamaica. So all pesticides being imported need to have an import permit from the Pesticides Control Authority. So there is no purchasing of pesticides on websites and bringing it in with freight forwarders. Prior to checking our website, we have the website that is www.caribpesticides.net. And this lists all the pesticides that are registered for usage in Jamaica. So pre-approval is necessary prior to the import of the pesticides. We also have to monitor the pesticides being imported for agricultural use. And remember, we have a lot of categories being used in the agricultural use. So pesticides would cover all the insecticides, herbicides, rodenticides, termaticides. So they're all specific killers of certain crops or certain pests. And the pests are the insect pests, rodents, which we know are the rats. We have plant pests, which are the herbicides, which kill herbicides. We have the termaticides, and I mentioned the insecticides before. So there are a number of different types of pesticides that are imported. So mainly we do understand that the pesticides on our food are mainly pesticides that are sold by farm stores, as we call them. So the Pesticides Control Authority also monitor the sale of pesticides that are being sold by these farm stores that are going on food. Earlier in my presentation, I mentioned that some of our functions will involve the training of persons and personnel. I believe Mrs. Webb Lawrence spoke earlier about the training conducted by the Rural Agricultural Development Authority. And she mentioned collaboration with the Pesticides Control Authority because our inspectors also offer training for the usage or safe usage of pesticides. We would have to be, well, we do this collaborative work with a number of agencies. So we are part of the Ministry of Health and Wellness. So you would understand that the public health is also a major collaborator. The Ministry of Agriculture through the RADA and the plant quarantine, and as well as the Food Storage Division are also major collaborators with working with Pesticides Control Authority. The selling of pesticides now, as I'm just managing to change the slide, I'm so sorry. But the restricted pesticides, we have a list in our second schedule of the Pesticides Act that include a group of pesticides which are called restricted pesticides. And these are the ones that are monitored by our inspectors mainly when they visit these farm stores. And the stores that sell these pesticides need to meet certain criteria to be licensed. So inspections are conducted, ensuring standards are met, and the standards are part of the licensing procedure. Licensing is granted for 3 years to these farm stores, and it's renewable. And part of what we look for specifically at farm stores as well is the compliance to our act, and repackaging of pesticides is prohibited by law. So we have to understand that pesticide labels give the information needed for the use, the proper use of pesticides. So here at PCA, we normally say the label is the law. So the pesticide use is given by using the label of these pesticides. When we have repackaged products, the repackaged products are dangerous to health of consumers who have no idea what is in the bottle or the little package. They would have a little package of somebody selling them something and they say, well, it's ants powder, or that this can be used on your crop at home, fruits and veg, because a lot of persons now are going into backyard gardening. And we have to understand that the PCA is here to in protecting others, in ensuring that when you are using pesticide, you always have the label attached to the pesticides, because the label will now determine what is the concentration you'll be using on your crop. If it is so in fact suited for that use, pre-harvest intervals are also necessary for the usage of pesticides. Another function of the PCA is to license pest control operator businesses. So the pest control operator businesses are licensed, as well as training and certification for pest control applicators that work with these businesses are done by the Pesticides Control Authority. So we have to remember that these businesses are responsible for providing pest control operations in households and commercial facilities. So anywhere that food is stored has a different guideline for the treatment of these with pesticides. So the pest control operators and the certified applicators have been trained, and in receiving their certificates, they understand the intricacies of treating around areas that food is prepared and stored. So it is important for anyone hiring a pest control operator to ensure that the business is licensed and that the business is using certified pest control applicators to carry out the functions around the food specifically. The contamination in food is generally caused by the misuse of pesticides, because misusing pesticides is dangerous. We all know that pesticides are killers, and that is what the word sides in all of them I mentioned to you: insecticide, termaticide, rodenticide, nematicide, herbicides. That word or the ending side means to kill. So if used incorrectly, pesticides can kill. And sometimes the non-target pest or the non-target animal is affected by the use of pesticides. So it causes serious harm to persons, to animals, and to the environment. So all pesticides need to be used in accordance with the labels. I mentioned earlier that the pre-harvest interval must be adhered to, and this is information that is found on the labels. And it provides growers with information required to ensure that residues in the treated produce will not exceed the maximum residual limits. So an MRL, the maximum residue limit, represents the maximum amount of pesticide residues that are expected to remain on food products. when the pesticide is used according to label directions. Again, I said that PCA works in collaboration with multiple agencies, and I will bring in, remind you of Mr. Rowe's presentation, where the plant quarantine also does sampling of products or produce for MRLs. We know that Jamaica is strict on certain crops that are exported from Jamaica, that the plant quarantine could provide us with the information on what is returned or what is held at the ports. But we are also mindful here in Jamaica for our consumers that these have to be tested. And the PCA is actually currently drafting MRL regulations. They are drafted and they are to be moved to the next stage, where it is important for Jamaica to be participatory in all of this standard, because if we do not have the standard, we do not have sanctions that persons can be held against. So just to wrap up, the PCA ensures that the registered pesticides for use in Jamaica are, it is difficult to use the word safe, but are rigorously evaluated to ensure that the risk does not outweigh the benefits of having these pesticides registered. We ensure that the pesticides that are being imported are registered pesticides. We have our inspectorate arm that does surveillance across the island to ensure that the pesticides being sold are registered pesticides and that they are being sold in containers that are intact with labels. So we encourage others to contact the PCA using our website, www.caribpesticides.net, or the contact numbers that are listed thereon. For further information, if any information is needed with regards to the pesticides usage in Jamaica. So I would just like to congratulate the team who put together this webinar today, and I hope that all the information shared has been received and ensure it's safe, the theme for today. Thank you for participating.
All right, thank you so much, Ms. Morrison from the Pesticides Control Authority. And our penultimate, or was our final presentation, is coming from Ms. Alicia Smith. She's the Acting Director of the Pharmaceutical and Regulatory Affairs at the Ministry of Health and Wellness. So I want to welcome Ms. Smith at this time to begin to share her screen. She has a presentation. While we wait for that, I just want Karen Brown, who won the prize earlier, can you just send me a direct message with your contact number? I think we're seeing several Karen Browns on there. I know Rebecca is one of them, but Karen had also won a prize in the first question. Just send me a private message with your telephone number, please. Thank you so much. Over to you, Ms. Smith.
Good afternoon, everyone. Are you all hearing me?
Yes, we're hearing you. Good afternoon.
Okay, right. Thanks for inviting us to participate in this forum, talking about food safety. A lot has been said since morning, and I will not keep you long, I promise. So the Standards and Regulation Division of the Ministry of Health and Wellness does play our own role in the food regulation and food safety. We have the Food and Drugs Act, which you notice is very old, but under the Food and Drugs Act, we do have a definition of food which guides us. And as you see there, it refers to any article, food or drink by man, includes chewing gum and that. And based on the presentations we have had since morning, we recognize that there are other definitions out there, but this is what really guides us. So this is what we have to work with. Section 5 speaks to conditions for sale of food. Section 6 speaks about labeling, and Section 7 deals with manufacturing. For the Food and Drug Regulation of 1975, Sections 7 to 38 also speaks to food, and it provides a definition for additives, coloring, artificial sweeteners, preservatives, as you see there. I've just pointed out just two of the regulations there. Just for example, person shall not sell food containing food additive except as provided in the regulation. And Section 37 even speaks to the container. You shouldn't use containers that could have contents, the contents of the container have that mix that is injurious to the person's health. So the Pharmaceutical and Regulatory Affairs branch of the Standards and Regulation Division is really the unit that carries out the mandate of the regulations here. We don't routinely participate in inspections of food manufacturing processes, except when we are required to do so. Sometimes we have clients or exporters from Jamaica to get into some markets. The market will ask for a health certificate or something from our department, and that's where we get involved. In addition to that, we also find that we are named on the Public Procurement Commission document, and therefore sometimes clients will come to us asking us for a letter, and to do that, we'd have to do an inspection of their facility. So our activities are mainly that of permit approval for importation and to a lesser extent exportation. The products of interest that we have are the food additives, food making health claims, dietary supplements, and the herbal preparations, including teas. The regulation of veterinary pharmaceutical products plays a role in that, based on things like the AMR, antimicrobial resistance, then the products that we register for use in animals could also affect the safety of food. And therefore that is one of the things that is not directly but indirectly affect food safety. Disinfectants used in food processing facilities also are part of what we regulate. And in fact, under the Food and Drugs Act of 1964, disinfectants used in food processing facilities are in fact referred to as drugs. So how do we assess most of the products that we handle? All applications presented for imports are assessed for efficacy, quality, and safety. And that's a standard throughout our Food and Drug Act, efficacy, quality, and safety. We also seek guidance, especially for food additives, from the Codex Alimentarius, the FAO approved list of food additives. And sometimes we also look at our reference countries like a US FDA to look at prohibited substances or substances prohibited for certain types of food. The documents we usually require for assessment for import permits include the labels, and this is mainly for the additives, the bulk, raw material, the labels, product formulation or product information, safety data sheets, and certificate of analysis. When we look also now at the finished products or food with health claims, and usually these are finished products that are coming to us, dietary supplements, herbal preparations, especially for commercialization. In addition to the labels, product formulation, and that we also want to see the manufacturing process, an outline of that, good manufacturing process certificate, and a certificate of free sale. That's basically how we do what we do. We usually say what we do is mainly a passive regulatory function, in that we don't do a lot of testing upfront. It's usually based on the document review at first. What are some of the opportunities we see for improvement? The fact that, as I've been hearing, there is a lot of testing going on sometimes of the sample, the products when they come in, but we don't get that feedback. So we don't know for sure if what we approve, and based on how we have assessed the documents that we got, if when the samples or the products actually come in, they meet specifications and they meet the standards that we saw. We also see the need for greater collaboration with other agencies to ensure the compliance. And we find that there are some resistance regulatory requirements, and that happens normally, but well, not normally, but especially for people who just want to have a free rein to bring in and sell. Because in our market, not everybody wants to sell, but we think that detailed and sustained sensitization and public education would take us to that. And again, Sarah speak, I thank you all for being here.
Thank you so very much, Ms. Smith, for your presentation. All right, so we can take any questions that we may have for persons in this segment, or overall. We're actually at the end of the webinar. I see a raised hand from Tazana Thomas. You can go ahead with your question. Tazana. All right, not seeing any questions there. There was a question regarding from Kerry that was saying several vets have expressed a desire to have, is it parakeet banned in Jamaica? What is the possibility of that happening? Which one of my panelists want to take that on?
Hi, good afternoon again, Stephen. I guess that one would be for me.
Yes.
Paraquat, that's paraquat.
Paraquat, yes, thank you.
I had not known of this, well, the question Kerry is asking here, that vets have expressed a desire to have paraquats banned. But I will say that the Pesticides Control Authority is also a part of the Rotterdam Convention that lists pesticides of, I would say, of importance. And it is one of those, paraquat is one of those that we do have a pesticide review committee that does review of the pesticides that are on our current registry from time to time. And part of that listing ensures that we do a comprehensive review of them. But we are going through the listing to ensure that we do not just ban something because it is the interest of, I would say, probably a small group. The part of the review that is done really looks at the risk versus the benefits. And if the risk is deemed greater than the benefits, we will definitely move to have certain chemicals moved to our prohibited list, because we do have from time to time chemicals moving to that prohibited list. So even things that would have been registered in Jamaica no longer available for sale and cannot be re-registered in Jamaica. So I had mentioned that registration process is 5 years, and even during that process, if we are reviewing the chemicals, usually we invite stakeholders to give their views and presentations. But with regards to the vets having this desire, we never had an official complaint coming from that group. So it is possible for us to include the complaints coming from the vets in our revision. So if there is a group that can put together something for us, the PCA is open to receiving this kind of information. So if it is affecting a certain category of animals, and if there is data that we can use in our review, it would be great for us, because this would show that the risk is higher for a certain category, possibly that we did not have listed in our review. So the possibility of banning a product is possible, but it's done after a detailed review.
All right, thank you so much, Ms. Morrison. There's a question here from Paul. He says, is there a difference in requirements for importation of pharmaceutical products for personal versus commercial use? So is there, I guess, or Ms. Smith can answer that. Is there a difference in requirements for importation of pharmaceutical products for personal versus commercial use? Lady Smith?
Okay. The law that we are working with does not stipulate commercial as opposed to personal. And basically what we have done over the years is use discretion to allow for personal use. So let's say somebody goes overseas and they see some vitamins on the shelf and they buy it and they bring it in, or no, people are shopping online. We are running into a bit of problem with that anyway, because people, as I say, we are all in this mode of business and entrepreneurship, and we're finding that people will bring things in. They'll say to you, it's personal use for me and my family or for myself, and things are finding itself in small shops, and people are selling. And once you're offering something to the public, it becomes now a public health matter, and it has to be strictly regulated. So we are pretty cautious now about doing things for personal use, because the law really does not stipulate that there's a non-compliance or there's a relaxing of the rules for personal use. However, the law does speak, well, I should say what the law does speak to is for prescription items. If a doctor requires a product that is not available on our market, there is a system where you can go through and get this product for this patient. But he couldn't say buy for his practice and have for all his patients that come in there. That's not allowed. It would have to be for person, a specific prescription for a time, and all of that. So there are stipulations, but the personal use thing is, as I say, has been discretionary, and we are finding that it might not be such a good thing to do.
Thank you, Ms. Smith. Karen, you have a question? Is this the real Karen?
Yes, thank you very much. It's a comment.
Sure.
Thank you. It has been a very informative and interesting seminar so far. Just to go back a little in history, I do recall the role of the pharmaceutical division in a particular incident where in one parish in one region, not to name it at this time, where we experienced saltpeter poisoning of a consumer having purchased an item that was deceptively labeled to look like black pepper, spice, etc. But it was in fact saltpeter, and the use of it had led to the demise of that particular individual from a particular parish. I do recall that the pharmaceutical division was involved, and the Bureau of Standards was also involved in looking at the particular labeling and actually made changes. And I was just wondering, to what extent are the agencies collaborating in this regard to ensure that there's adequate labeling so that we can continue, for example, in this case, so that we can continue to protect our consumers. That is one. There was also an incident which I can recall in a particular parish involved a recent demise of a consumer who bought a product which would have been called a strongback juice, where the person was actually doing a manufacturing of strongback juice in his or her home, and there may have been some cross-contamination, and it spoke to the need of maybe greater public awareness for the persons who intend to do those forms of manufacturing, as well as for the consumers who intend to purchase products, and to indicate to them the particular risk. We also have observed that the police has been involved in receiving reports of poisoning and people who may have died, and some of these may have been dealt with by the police as a police matter, without the emphasis of the the regulators that are required to be involved in the process. I was just wondering to what extent would we consider the police as a stakeholder or a regulator in this? And I think I'm going to finish with my questions and comments.
All right. Thank you so much. Any of my panelists want to give a response? Any from my panel? And I think Paul deserves a prize. Paul has been asking a lot of questions, and we appreciate those. We appreciate those questions. So Paul Brown just sent us a private message. Renee, we have a prize for him, right? We should be able to find a prize for him for his act. He has made the webinar very, very interactive, paid lots of attention, and are able to ask some questions. All right, I want to say thanks. If there are no further questions or comments, I don't know if Tazana is on yet. She had a raised hand, maybe from earlier, but we're not seeing her. But I want to thank you all for participating and being on this webinar. Thanks to the organizing committee from the various ministries, from the presenters, from the ministries of Agriculture and Fisheries, the Ministry of Industry, Investment and Commerce, the Ministry of Health and Wellness, and our agencies and other partners. Thank you so much for your support. PAHO, of course, tremendous support for this. And remember, we are recognizing World Food Safety Day on Monday, June 7th. So we look forward to seeing the content. We actually have a closing ceremony that will be held at 10 o'clock on Monday. So you are all invited to join that ceremony on Monday as we commemorate World Food Safety Day. And of course, we say food safety is everybody's business. So we ask that you continue to share the information internally and externally, and to get everybody involved in food safety. So thank you so much to everyone for participating. Thank you again to our presenters. Have a good rest of afternoon, and enjoy your weekend. Thank you so much. Take care, everybody. Please continue to be safe.